we are in the best company of Dr. Mayukh Hazra. Dr. Mayukh Hazra is rank 29, NEET PG 2023. There cannot be a great timing than this. Yesterday, NEET PG results are out. Sorry, INI-CET results are out. And today we have Dr. Mayukh Hazra going live by solving the grand test of DocTutorials. And he's going to take us through the entire grand test live by streaming it on his YouTube channel. The activity initiated by DocTutorials and greatly supported by Dr. Mayukh Hazra will help all the future aspirants in understanding how a topper thinks while attempting his grand test, how to think like a topper, and how to solve each and every question, how to pursue the questions in right way so that you can excel in your examinations. Dr. Mayukh Hazra is All India rank 29 in NEET PG 2023. He has pursued his undergraduate from Medical College, Kolkata, and right now he is MD Dermatology at Medical College, Kolkata. I strongly remember interacting with him in 2023 March during our masterclass session in Kolkata for the subject of ENT taken by Dr. Rajiv Dhawan sir. Over to you, Dr. Mayukh, if you can share us a couple of memories of attempting DocTutorials Grand Test before and about the interaction we had during the session at Kolkata.
Yeah, thank you, sir. It's a great opportunity that DocTutorials is organizing. And I think the idea is also very much innovative, that showing live that how means toppers solve the MCQs. I don't know how much I am going to recall because it has been 1.5 years when I have given my last exam, that is the May INI-CET. But I would try my best, and more than solving the questions, I would try to tell the audience that how I am going about solving the question. And yes, I had attempted 1 or 2 GTs just before the NEET PG. I had maybe the INI-CET I had attended one mock GT also. So there my rank was 12. And yes, sir, the session of Dr. Rajiv Dhawan sir was great, and he summarized all the ENT within a couple of pages, about 30 to 40 pages. His notes was very much crisp and concise.
Sir, also we have added a new feature. Now with the grand test, which a student is going to attempt, in the review section, we are going to give the video explanation of our faculties, explaining the answer in detail so that the question and the answer now will be easily understood by the students. So, sir, I'll keep the entire floor open for you. Now you can share your screen and attempt the GT. And to all the aspirants who are watching this session, it will be a great learning curve for all of you. You'll learn a lot after watching the entire grand test. And I hope this attempt by DocTutorials in partnership, in collaboration with Dr. Mayukh Hazra, will help all of you in securing good rank in your upcoming NEET PG and INI-CET examination. So now you can share your screen.
Then okay, sir. Then I think some GTs are popping up. Let's see which one to do. I am going for 23 because I gave the exam in 23 only. So, sir, shall I start? Okay, then I am starting it. The main thing is that sitting for 3.5 hours would be an issue for me because for 1.5 years, I haven't solved any question. Once I had taken a challenge, but after that, I haven't given. So it would be a test for me also, and I would try to explain. And don't judge me if I do some mistakes and all, because it has been 1.5 years. So which one of the following nerve pierces the clavipectoral fascia? Nerve to subclavius is not. Probably it is the means I have to go from my instinct. It is the lateral pectoral nerve. I would mark it for review. Now coming next, Manjula, 47 years old woman, hot flushes, postmenstrual symptom. Hot flushes can be relieved with administration of. We would give hormone replacement therapy. So it is ethinyl estradiol. 7 next. Body weight, not sure, but I think it would be Plockett's test. It was 1:70, means I am having a bit of hazy memory, but I think it would be Plockett's test. But I am marking it for review. I would think on it again. 25 years old lady has a bilateral conductive hearing loss since 4 years worsened during pregnancy, means it is a case of otosclerosis probably. The hearing loss is gradual and progressive in nature. She also mentions hearing better in noisy area environment. Type of that would be AS. S for sclerosis. A is the pattern and S for sclerosis. You can remember. So dermatology question, I shouldn't miss it. At least derma questions, I should get it all correct. Right, guys? So 14-year-old patient with patchy hair loss over the scalp, that is near the temples. So it is accessible for our hands also. What is the diagnosis of this condition? It would be trichotillomania, because it is approachable also, and patchy hair loss, that much round or exclamation mark here we are not seeing, so it won't be alopecia areata, it would be trichotillomania. Census method, this I don't have any idea now. Anyone would be there, but I can guess it afterwards. Now I am not attempting. So this is a long question. 32-year-old woman presents to her primary care physician with complaints of fatigue, weight gain, constipation. Past few years, she reports feeling cold. So I think this is a case of hypothyroidism. Becomes dry also. Dry is a case of hypothyroidism, pale. But always, guys, read the whole question. So TSH, puffy around eyes, voice hoarseness, thyroid. TSH is 20, so hypothyroid. Thyroxine is less. Most likely hypothyroidism, thyroid synthesis, means if you don't know the stem also, by the TSH level and the T4 level you can guess. ECG, acute onset breathlessness. What is the confirmatory test for the diagnosis of patient? Let's see the ECG. Two kinds of waves I can see in the lead two. Let's check the axis, AVF, and 2 axis is normal, but there are two kinds of waves, means oscillation is happening in the heart. That's why two kinds of wave are appearing. So I think this is a case of pericardial effusion, and we can do echo. Wow, I still remember something at least. Any comments? Are you guys liking the session? Means rather than my solving the MCQs, I would try to highlight that the residual knowledge I am having still after 1.5 years, I am applying it how. And that's the take home point, that you should not ratify things and vomit in the exam. You should keep it in long term memory. A 50-year-old male had a fever, abdominal distension. So fever, abdominal distension, Kalazar way it is going. Not responded to antimicrobials, antibiotics. So RK39 positive. So it is Kalazar. So which one of the following drug could be used? Liposomal amphotericin B is the drug of choice. Though we give a first line, being a dermatology resident, we give stibogluconate as the first line. Means my sir asked me a few days back only the question, and I told sir liposomal amphotericin B, but we know that the drug is costly and administering it is difficult. So he said that first line is stibogluconate. Miltefosine also you can give, but it is the second line drug. And one trivia also I am telling you that UN Brahmachari. So we have a hall of UN Brahmachari in Medical College Kolkata. So he first discovered the urea stibamine compound, which was used in treatment of Kalazar. And now also we are doing the stibogluconate. Okay. So which one of the following is true about degenerative myopia? Means I think pathological myopia only they are telling. So less than 6 won't be true. Tractional retinal detachment, yes. Tractional, not tractional. It is causing hole. And short silk-like retina. Lattice degenerations are common. This would be the point. Lattice degeneration, then it is turning into macular hole. After that, it is turning into a full blown retinal detachment. Not a complication of elbow dislocation. So around elbow we are having median nerve, brachial artery, radial nerve also. Radial elbow dislocations. I think myositis ossificans, it is a complication of elbow fracture. Means when you rub it vigorously, then the clotted blood with calcium it combines and it forms bone. So I think it is myositis ossificans. I don't know for sure. Mark review and next. So 54-year-old woman, ill-defined lump on the left breast, 8 months. On examination, size is 4 into 4 centimeter, non-tender, ill-defined. So ill-defined mass 54. So it is old age, not fibroadenoma. Uh, Outer quarter, overlying skin, nipple, and lymph nodes are normal. Lymph nodes, everything is normal. The lesion, histopathological imaging. I think it is phyllodes tumor, no lymph node involvement. Histopathological image is also looking like that. I can't describe because I don't have that much of memory regarding the histopathological image, but my insight is telling and the sixth sense is telling that it is the image of phyllodes. So I am going with phyllodes. Fibroadenoma this age can't happen. Lobular cancer, carcinoma, no involvement is there. Mucous carcinoma is also very much dangerous. So it is not a case of cancer. Like this, you have to rule out options, guys, by seeing each and every information from the question. And if you want to know more about the ruling out options, you can see in my channel also the top video which I have kept in description in my channel only. So it is ruling out options, and I am going to do it in the same way with live demonstration. I haven't solved these questions because you can see in my account it is live only. Term infant intubated in labor room, baby is ventilated, put in SIMB, X-ray is taken for probable diagnosis. So this is a case of, see, the bowel loops are in the chest. So congenital diaphragmatic hernia. So congenital diaphragmatic hernia, yes. A 29-year-old medical student was brought to pulmonologist with complaints of shortness of breath while was prescription asthma. Okay. States that it has a very high therapeutic index. So adenosine means it is theophylline, acting on adenosine receptors. Which of the statements best characterizes the drug with respect to therapeutic index? Sorry, a bit of noise might come for 20 minutes. Bear with it because their RT is going on. The drug serum levels is likely to be needed to be carefully monitored. Drug is likely to cross blood-brain barrier. Not sure about this. Trying to rule out options. The drug is likely to have what does respect to therapeutic index, so it should be monitored carefully, like, right? A 35-year-old woman complained to doctor about nausea, vomiting, traveling a bus, motion sickness. Which one of the nuclei would the impulse transfer to the chemoreceptor trigger zone? Okay, not sure, but vestibular nucleus I am marking for review later, I would see. Diagnosis retrograde pyelourethrogram. Two double ureter are there. Left-sided double ureter. Diagnosis. Pelviureteric duct obstruction. No, there are two ureters I can see. Not a case of staghorn calculus. Left double pelvis. Not only pelvis, ureter is also double. So left double ureter I am going with. I think there was a principle also. Wigert-Meyer law. I think this law is called Potter tip. Potter tip. Potter's tip. I think policeman tip and only. So it is a case of Erb's palsy. Cardiovascular change is not physiological in pregnancy, means not a physiological change in pregnancy. Split first heart sound, splitting might be there. Mid diastolic murmur. Mid diastolic murmur should not be there. There should be hyperdynamic circulation and it could cause ejection systolic murmur. Let's see other. Shifting of apex beat towards fourth ICS because yes, the diaphragm is shifting up outwards. Decreased peripheral vascular resistance. It is also true. So I am going with mid diastolic murmur. Paradoxical undressing hypothermia. I remember the image. You can also go and see the image of my textbook and also what sirs used to show. So it is hypothermia. Not going to rule out any options also today. 12-year-old boy with recurrent episodes of profuse epistaxis, reddish nasal mass, seen filling the nasal cavity, which investigation you should be avoided. So this is also a previous NEET PG question only. This is a case of juvenile nasopharyngeal angiofibroma. So we are going to contradict the biopsy. Okay, biopsy, there could be torrential bleeding. If also you are doing biopsy, then it is to be done in the OT where you can control the bleeding. Or else if you do the biopsy, then torrential bleeding and patient death. 55-year-old known case of mycosis fungoides develops skin lesions in neck. On examination, there is poikiloderma. Okay, poikiloderma. A bit of forgetting. I have read in derma. Which of the following not included in the triad of poikiloderma? Skin atrophy, telangiectasia, and pigmentary changes. These are there. Skin hypertrophy is not seen. Minimum antenatal visit. My God, OBGY again. OBGY means I didn't like. That is not the thing. But now the all the comment perspective I have forgot. So I think it is four. One in first, second, and two in third. Maybe I think it's four. You guys also could help me in writing in the comment section, right? You could help me after I am solving after 1.5 years. So a patient presents with swelling and tenderness in the joints, extremities, joint. Okay. Examination, synovial fluid extracted. Oh, I have to take care of the time also, right? So we have time. I can explain. Synovial fluid from the big toe. Big toe, so it is pointing towards scout. And presence of ureate. Monosodium urate crystals, confirm the diagnosis. Drug was prescribed which relieves the symptoms. Mechanism is competitive and suicidal inhibition. Which one of the following is given below? So in acute attack, we use NSAIDs, but suicidal inhibition is seen with allopurinol. Okay, good questions, means need standard questions only. I think much improved from last time I had given DocTutorials GTs, and it is neat pattern only. The standard is 40-year-old female. Because why I am saying it, because after 1 and 5 years I could solve some questions at least. So I think the question standard is like neat only. 40-year-old female presented with symmetrical polyarthritis, morning stiffness. So it is going towards rheumatoid arthritis, immunological, that gradually resolves in an hour. Which is the correct statement? NSAIDs improve symptoms and disease modifying activity? No. DMARDs are used for disease modifying activity. Absence of erosion on X-ray rules out the diagnosis? No. First, periarticular osteopenia is seen. That is the first sign. This is also asked in previous year question. Raised ESR CRP? Yes, definitely. I know this. And D, I don't know. HLA DR4, I don't know actually about that. But C is only correct. A and B are ruled out. So I would go with C and D. All of the following statements about toxoplasma is true except oocysts is freshly passed. Sporulated oocysts are infective from the cat. May spread by organ transplantation. Not sure about that. This one is true. First one is. Maternal infection acquired after 6 months has high risk of transmission. Probably true. It is a zoonosis. Zoonosis is true. I think B would be the answer. Not marking for review also. Muscle responsible for accommodation are innervated by the nerves passing through which structure? Accommodation. Eye accommodation. Nerve passing through which structure? So Edinger Westphal nucleus is there. Pretectal nucleus. You have to think about that. Among pretectal and Edinger Westphal nucleus only, I have to think about that. Edinger or Edinger 2 is originating, I think. Pretectal, I'm Edinger only I'm marking, not sure. So this is a case I can see fracture of clavicle. Image anteroposterior clavicle radiograph, 40-year cyclist sustained an injury crashing during race. So non-surgical treatment will most likely provide an positive outcome. Which non-surgical treatment would provide positive outcome? Non-surgical higher satisfaction, faster return to activities, lower reoperation rates will mostly lead to in which positive outcome? Okay, higher satisfaction, faster return to activities. I hope lower reoperation rates. I'm leaving it for now. This is a new question. A 43-year-old woman presented with symptoms of fatigue, myalgia, fever, and neck pain for 1 week. Anything related to thyroid? Biopsy performed. Microscopic image shown below. What is the likely diagnosis? So D-Querban is painful, I think. Yeah, Hashimoto to hypothyroid. D-Querban is painful uh, as far as I know. Riddles is fibrosis. 2-month-old infant with rashes in the diaper area. Okay, after using diaper for 12 hours, first line treatment. So this is a diaper rash, diaper dermatitis. So my derma case only. So what I would do? Frequently changing the diapers. Diaper induced dermatitis in the diaper area. They are telling two cases could be there. One could be diaper induced, one could be the fecal matter induced. So which they are telling means in which area. Actually, by seeing the clinical case I can understand that in which area it is affecting. Is it affecting the buccal means buttock creases, or is it affecting um, the gutter areas, the rubber band areas where it is stuck? So I have to see diaper dermatitis. So I would go for, I think, diaper free period. If it was due to diaper fecal matter, then frequent changes would be there, and diaper free period also. I am going with diaper free period only. 45-year-old patient RA, new biological, which has CD28. Okay, rheumatoid arthritis competes with CD28. Adalimumab is not. ACE inhibitor को गोली मारो. What's the mnemonic? ACE, adalimumab, golimumab, ACE inhibitor. These are all IL-1 in the group of infliximab. TNF alpha ACE inhibitor. Abatacept is also not. I think sarilumab. Don't remember much of pharma, but I think sarilumab. A 78-year-old female complained of vertigo. Vertigo is there. Intermittent weakness in the right lower limb. Right lower limb, there is weakness. Okay, severe headache. Can't make it till now. On physical examination, there is plethoric face, conjunctival injection, vertigo, weakness, all over dusky complexion are observed. So pulse is less, BP is high, WBC is less, platelets is increased, regular rate and rhythm. So is it a case of Waldenstrom? Could it be Waldenstrom macroglobulinemia, severe headache, stroke, anything? Let's see the options. In this disease, the viscosity of blood is drastically decreased. डिक्रीज तो नहीं होना चाहिए, किसी में भी तो डिक्रीज नहीं होता है. Platelet is increased, RBC is decreased, so platelet cell line. So thrombocytosis essential. CML could it be? WBC count is high, but not that much high. Wait. Oh, RBC count is 8 million. So this is a case of polycythemia, rubra vera. You think? I missed this 8 million. And hematocrit is 65%. All other cell lines are also increased. So blood viscosity decrease won't be the case. CML is not the case. Polycythemia vera only. Let's move. What is showing name? Congenital urogenital condition. Is it any kind of means retrograde pyelourethrogram? Anything? Just X-ray is shown. Hypospadias, how I can see in X-ray? It won't be the answer. Ectopia vesicae. Ectopia vesicae clinical image was asked in NEET PG, but vesicoureteric reflux, how I can see just by an X-ray. Posterior urethral valve, I think it would be ectopia vesicae because I can't see a bladder as such. So I'm going with this. Dorsiflexion is brought by all muscles except tibialis anterior. Yes, it is in the anterior compartment, so dorsiflexion would be there. Extensor means though it would cause dorsiflexion. Peroneus longus. Peroneus longus also does. Dorsiflexion, wait. Ventral flexion, dorsiflexion, yes. Tibialis anterior. Hmm. Extensor digitorum longus, all if it does, it would do. I think it would be extensor hallucis longus because it is only going for only the hallux. So it is extending the hallux. If I move my finger also, so it is not causing any kind of dorsiflexion. If I feel the tendon and extend my hallux, so it would be extensor hallucis longus. Recurrent abortions are seen in all except torch infection. Yes, it could be seen. Recurrent. Now, among torch, it was syphilis. In case of only syphilis, there could be recurrent. But in case of torch, only single time it could be seen. Uterine pathology would be there, would be the answer. And balanced parenteral translocation is ruled out. Uterine pathology, recurrent it causes, and balanced parenteral translocation also it causes recurrent. I hope none of the above or torch infection. Infection generally causes once. Only in case of the Kasowitz rule of syphilis, it was causing multiple number of times. So I'm leaving it for now. Once identify with the false statement regarding aberration. I liked forensic very much. So involves superficial layer of the skin. Yes. Caused by contact with rough surface. Yes. Sharp objects cannot cause it. No, sharp objects can also cause it, I think. Direction of application of the force could be determined by the examining the wound. Yes. By the skin tags where it is lying. So sharp object cannot cause it. A singer underwent thyroid surgery. Her recovery was satisfactory except that she is unable to sing at higher notes. Higher notes. So vocal tuning, I think cricothyroid, higher pitch. Now nerve I have to remember. So what is the possible nerve injury? So I think it is glossopharyngeal. Glossopharyngeal probably. Mm, Glossopharyngeal. I hope. Vegas only cricothyroid was supplied by the other. Glossopharyngeal is ear. Superior laryngeal nerve. Superior, it had external and internal, right? Superior laryngeal nerve. Another part was recurrent laryngeal nerve. So superior has internal and external. I think that the external supplies. Not sure. I'm going with that. Okay, so severe sunburn, only a few minutes in sun. So sun photosensitivity. By seeing the picture, I am telling this is a case of xeroderma pigmentosa. I have seen the cases, and I would go into the stem. Here we can see a case of BCC or squamous cell, more of a BCC, I would say. Squamous cell cancers could be seen. The classical pigmentation of the raindrop pigmentation I can see. So let's read the question. On examination, freckles is a characteristic. So I've got three questions from Dermat till now. Skin pigmentation and skin pigmentation is noted. What is the diagnosis? Xeroderma pigmentosa is given there. So definitely xeroderma pigmentosa, nothing else. So a 37 years old pregnant woman attends the antenatal clinic at PHC. She has had not any antenatal visit till now. Okay. So the best approach here regarding the TT immunization would be 37 weeks. Give a TT and explain it to her. It would not protect the newborn. She should take second dose after 7 minutes. If she delivers in meantime also. Do not waste TT vaccine. Neonatal tetanus during that delivery only it is having. During the delivery only it is having. So give one dose of TT. Explain it. It is useful. How much time is left? 12 minutes. It is useful for this pregnancy. Uh, won't be useful, I think. By first dose, will it be useful? New question. This is also a new question. Means not a previous question. Interesting one. So I have to rule out options again. Give tetanus immunoglobulin along with TT vaccine. Immunoglobulin, though, I am giving in case of road traffic accidents. Should I give it? I don't think so. That much of logic, but could be. It could be. Give one dose of TT. It would be useful. It will not be useful for this pregnancy. Don't waste TT. It would anyhow be of no use in pregnancy. I think this rules out the option. Give one dose of TT. Explain it will not be useful in this pregnancy. This could also be there. So I am stuck with three options. Three options when you are stuck. According to your attempts, you should go for a call. Okay, means in three options you can go because in case of NEET you have 1/4 as negative. When there are only two options, then definitely you should go for that question. But now I am stuck with three options. TT immunization. Give a dose of TT. Explain that it will not protect her newborn. She should take the second dose 4 weeks. When if she delivers in meantime, I am giving her a tetanus booster dose. Okay, this I can do. Give one dose. So these are overlapping questions. Means one dose. Why won't I give it another dose? So I think I am stuck with A and D. Give anti-tetanus immunoglobulin along with TT vaccine. I would go with A. My sixth sense is telling go with A. So I'm going with that. Biochemistry, right? So 30-year-old woman presents to her physician with muscle weakness. Muscle weakness is there. Fatigue, exercise intolerance. Okay, exercise intolerance in case of glycogen storage disorder. Exercise intolerance, McArdle's disease, I remember. Physical examination reveals hepatomegaly. So hepatic involvement is also there. Okay. Laboratory investigation shows elevated levels of lactate and adenine with hypoglycemia. So a case of muscle story. Muscle with that, which enzyme is most likely to be deficient? Elevated lactate, alanine. Lactate and alanine. Pyruvate, pyruvate, phosphate. So the options are glucose 6 phosphatase. No, 30-year-old glucose 6 phosphatase won't be there. Phosphofructokinase, we can see muscle weakness. Glucose 6 phosphate dehydrogenase, no, because it is a case of means favism it causes. Um, Glucose 6 phosphatase. Hexokinase. Which enzyme deficiency is most likely responsible for the patient's symptom? Glucose 6 phosphate dehydrogenase I have ruled out. Hexokinase, if hexokinase is deficient, would be the problem. So the if hexokinase is deficient, then the whole of glycolysis would only not go, right? If hexokinase is deficient, hexokinase first step of glycolysis, so glycolysis won't go on only. So if glycolysis doesn't go on, then how can lactate and alanine be formed? So this is also ruled out. Phosphofructokinase, muscle weakness is there, and more than muscle weakness, there is hemolysis could be seen in case of phosphofructokinase. Most common cause is G6PD. After that is phosphofructokinase and pyruvate kinase. I think it is glucose 6 phosphatase, glucose 6 phosphatase. So it is releasing the glucose from liver. Hypoglycemia would be seen, hepatomegaly would be seen in that case. And glucose 6 phosphatase enzyme is not there in muscle. A bit of confused, I'm marking it for review. Patient presented with bitemporal hemianopia, pituitary tumor, it is seen mainly. On imaging, aneurysm pressing on the optic chiasma. Which artery is involved? So anterior communicating should be involved from the Willis, circle of Willis. Okay, so 40 questions are over. Let's see not answered questions. How I should go? Okay, here I can see them. think de facto. Not sure about that. Now another image anterior posterior cavity. Non-surgical management, which will most likely lead to a positive outcome. Higher satisfaction, non-surgical. What is the relation? Lower reoperation rates? I don't think so. Faster return to higher union rates. I think faster return to activities would be the answer. And always when you click an answer, see, do a save and next. And always give a GT in a laptop. Then only this kind of screen would be visible. While touching, you won't get the actual feel. So I'm also giving in laptop, and you can see that um, in webcam of laptop is not at all good, and the quality of video is not good at all for my recurrent abortion again. Lens parental translocation. Torch is a kind of congenital infection. So congenital infection, when it is present, it would transmit at that time, but the infection won't persist. I think it would. I would go for torch infection only. Now coming to the mark for review. I am not changing my option. Going for that. I would means I have partial knowledge, but I am going to target for high only. Maybe I would get negative. Elbow dislocation, myositis ossificans. Chemoreceptor triggers one. Raphe nucleus related to wake cycle. Edinger Westphal to not. Lateral geniculate also I don't think so. Lateral geniculate mainly related to the site. So I'm not marking for you. This one is confusing me, right? Yeah, I'm going for glucose 6 phosphatase main is I'm going for that only. This one. Okay, I'm seeing the chat. Answers are there. I don't know which question answer. But if you want to ask me, because 3 minutes are left, you can ask me anything. And I would also take a bit of rest. Any questions you want to ask me in live chat, you can ask me. Now I'm going to see for these 2 minutes, because after that next session would start. Another questions I had left, right? So de jure. De facto means de, I think, related to facts. And de jure would be what? Not sure. I'm not going to attempt it. If I don't have any idea, means anyone would be there. Both and none, I don't think so. It would be there. How to rule out options? How to rule out options in a long questions? I make you means you have to read it thoroughly. Means each and every point, like I was doing, and I would be doing in future also. Let me see the timing. So 1 minute is still left. So when I am reading a line, I am trying to make a diagnosis. Like I read bitemporal hemianopia, I make a diagnosis in my mind that it is pituitary adenoma. Then I saw that it is a case of aneurysm causing compression in the optic chiasma. So what would be the aneurysm? So I changed the answer. But many times you were seeing that in case of xeroderma pigmentosa, I am getting the point directly. So you keep a diagnosis in your mind, then again you read all the points, you keep each and every point, this one, this one, this one, correlation you have to do. These types of question answering would be helpful for the upcoming FMG. Yes. Yes, now the FMG standard is more shifted towards the NEET PG exam only. So, and NEET PG is going to be like the INI-CET standard. Like this year, INI-CET November was much easier than the NEET PG. So we are seeing a overlap of things, and yes, this kind of question would help you for FMG also. And FMG questions also, I'd seen that they are mainly repeated from the INI-CET and NEET PG. So you should do for FMG at least 3 years of FMG, 3 years of NEET PG, and 3 years of INI-CET also, because I solved few FMG questions and the diabetic cheeriopathy was there in the FMG. So even INI-CET is a different board, but they do ask from there also. They copy the questions and they do ask. So again, session is going to start, and it is a lot training. Just solving questions is a bit different, but explaining it is also a bit of different. So Bihar, Kalazar, no. Blood examination reveals microfilaria. Okay, so microfilaria infection with two spaced nuclei. Two spaced nuclei. I am giving you a mnemonic. Okay, you won't forget it for life. Like this also means I don't have that much of memory power. I use mnemonics and all memorizing tricks to memorize. So two spaced nuclei. So learn the mnemonic that wedding full. Nah, sorry. Love full, wedding nil. So Loa Loa has full of nuclei. Wedding means which area has no nuclei. So Brugia should have two nuclei. Means love full, wedding nil means you are doing love only, wedding. That's why you can see that the total fertility rate of India is decreasing. And concerning figures, I'm having a watch on the news also. So it has come down to about 2%, 2 or less than 2 also. All the major countries have come down. So no wedding, don't do that. With love, do wedding also. Um, a 5-year-old patient came for evaluation of extropia, divergent extropia. So extropia happens because of myopia. Converging would be there in case of, yeah. So you would do action with fogging method, auto refraction with the use of accommodative triretinoscopy. So I think it would be retinoscopy also we can do for, but I think auto refraction I am marking it for review once. 80-year-old 80-year-old male complains of forgetfulness. His relatives also complain of gradual memory loss. Alzheimer's, my first guess. He later develops simple mathematical calculation issues. A few months later, incontinence, walking problems. He later died of pneumonia, aspiration. Autopsy revealed neurotic plaque. So, Alzheimer's. My first guess was right. So, like this, with the question first guess, then you correct your guess. Which of the predominant protein? Alpha synuclein. Uh, alpha synuclein and A beta pleated sheep. So, alpha synucleopathy, I think it was Parkinson. A beta lipoprotein is in case of Alzheimer's. Which of the following statement is false regarding thumb sucking? It is a source of pleasure. False. Malocclusion of teeth it can cause. It must be vigorously treated in first year. This is also a new question. I haven't come across such question till now. Source of pleasure to it would be there. It is a sign of insecurity. Insecurity could be there. Must be vigorously treated in first year. I don't think that we should vigorously treat in case. So I would go with it must be treated vigorously in first year. Marking it for review also. Emergency department abnormal heart rhythm. What is causing that? Later laboratory tests reveal. So hyperkalemia is the cause. So hyperkalemia first drug or least useful they are asking. So new question, least useful in the treatment. First drug that you should give in hyperkalemia is calcium gluconate so that your heart arrhythmia doesn't occur. Salbutamol we give, insulin we give, magnesium sulfate we give for hypercalcemia. That's the option. Cronaxer. Arey bhai, this one. Uh, yeah, Cronaxer was there in case of physiology. It was there. Romberg and Cronaxer, I don't remember exactly. Is a measure of excitability of tissue. Okay, so which has the highest excitability to the lowest excitability. Highest excitability. Okay, let's see. Uh, Myelinated nerve, unmyelinated nerve. So we see at first the options. So AA in two cases, AA is given. One option B, that is skeletal muscle. Skeletal muscle has a more negative value. It won't be the case. Cardiac muscle, anywhere it is given. Yeah, it is given in cardiac muscle. After that is unmyelinated nerve. After that is smooth muscle. After that is smooth muscle. Unmyelinated nerve, cardiac muscle. I would later attempt it to drain much of my energy. Which of the following is not an indication of prostatectomy in case of BPH? Acute retention. Should I do acute retention? Why should I do prostatectomy? I don't know. Residual volume more than 40. Yes, we do that. Chronic retention causing renal impairment. Chronic retention. Chronic time it is being written. Renal impairment. Yes, we should do. Diverticulum also. I think we should do. I think it would be acute retention. Section B is a bit tougher. I think. Protrusion of meninges in spinal cord in a dilated central canal from a spina bifida result in formation of cystic field with cerebrospinal fluid. Central canal dilated from spina bifida. Cystic fluid, meninges, meningocele, meningomyelocele. Probably a case of myelocele. Meninges is also there. Meningomyelocele. One. So, which of the following is the commonest congenital abnormality? Septate uterus was the most commonest. Forensic expert assisting the police in investigation of death of a woman. On examination, Kevorkian sign is noticed. Hey, how was the these all details you remember when you practice? So this is a thing that you should keep in the if you are in the culture, then only you can answer. So I have to go by intuition this time. Kevorkian sign, I think 3 to 4 hours. I am not. This is simply a guess. So, a 33-year-old female suddenly developed aphonia. A laryngeal endoscopy shows immobile cords, aphonia suddenly. What is the diagnosis? Open. Suddenly aphonia. Suddenly कैसे palsy हो सकता है? I think it's functional, but mobile cords. Bilateral abductor palsy, if it would be there, then it would be a adducted position. It is in an abducted position only. So suddenly, why would someone develop a palsy? Anesthesia is not there. Not there. I think functional aphonia I would go with. Females have a psychological issues. Females suffer from psychological issues more, be it the conversion syndrome or anything, or the functional blindness, functional aphonia. So I'm gone with that only. Copious, copious discharge, watery, foul-smelling vaginal discharge. Okay. Which one of the following is used? So AMCEL criteria not included. Okay. If test positive, yes. White homogeneous clue cells, vaginal pH less than 4.5. Uh, More than 4.5, I think. Yes. Glue cells, glue cells, glue cells. Was it 10% or 20%? Glue cells 10 or 20? I'm confused, but I think pH is more than 4.5, because in acidic condition, if it is turned into basic in case of menstruation, the blood turns into basic. So it is pH 4 point more than 4.5, I think. So which one of the is not included? So I think that would be the option. Which one of the following is not a component of in the concept of screening? Not a component of screening. Okay. Search for unrecognized diseases. Yeah, we do it. Undertaken among person who have clearly early symptoms of the disease. If they have symptom, will it be screening? Yeah, it would be. Undertaken by means of test which can be rapidly applied. Yes, screening is rapidly applied. Undertaken to sort out probably who probably have a disease from who don't. So screening, I think screening is before the disease, who have early symptoms of disease. So I think this is not a component of screening, because when it has clinically been applied. Now, a 25-year-old female presents with a history of hypermobility. So, hypermobility, Marfan, skin hyperextensibility, so skin also. So, Ehlers-Danlos. Upon further investigation, she has a deficiency in an enzyme responsible for a specific glycosamine. This is an issue. Lysyl hydroxylase. Minky skinky hair. Uh, Lysyl hydroxylase, it is minky skinky hair. Beta glucuronidase, it is gorgeous. Uh, Within 1 and 2. Aryl sulfatase Philippine. I'm going with in glucose amino. Not sure. Marking it for you. 77-year-old woman presents in emergency department. Sudden onset visual loss in her left eye. She reports increased fatigue past month and pain in jaw muscle while chewing. On examination, the temporal artery tenderness, giant cell arteritis, visual acuity, yes, amaurosis fugax also occurs, and sudden blindness, prominent left ear. Her optic nerve applies pallid and edematous, while her right disc is normal. She has inferior visual field loss. Inferior means the superior part. ESR is there. Most appropriate management. IV steroids, man. Previous year question. HIV infected because this is a case of giant cell arteritis. So it is an inflammatory condition and you give steroids to reduce the inflammation. In case of HIV infected individuals, gram stain of the lung aspirate shows yeast-like morphology. Okay, yeast-like. All of the following likely diagnosis except so which does not have an yeast form. Oh God. I think Aspergillus doesn't have Cryptococcus. Going with Aspergillus, marking it for review. Man causing a pupillary defect and a homogeneous hemianopia. Homogeneous hemianopia. Which one of the following sites is affected? So, homogeneous hemianopia. So, this would be a case of occipital temporal. No, it would be a case of optic tract defect. A 30-year-old male complains of recurrent back pain, stiffness in the spinal region. So, this is a maybe a case of Angstrom. Let's see. It shows what is the probable diagnosis: bamboo spine, ankylosis spondylitis, chill. Michaelis Goodman body. It is showing the Michaelis Goodman body. I think Malakoplakia. I have to remember. Interstitial, was it there? It is a previous year questions. So I think Malakoplakia only. Polypoidal cystitis, not bad. Bladder extrophy, no. This is a case of, I think, Malakoplakia. I'm going with that one. Which one of the following is least common cause of sepsis in neonates? Least common. Wow. I knew the most common. So I'm going to skip it for now. I have to think about that. A 45-year-old man with hypertension, thiazide, diuretic have been prescribed. He is still having is still having is still having continued elevated BP. His physician is given spironolactone to his existing medicine. Okay, elevated BP, spironolactone. The inclusion of spironolactone to thiazide diuretic is done to achieve which of the following effect? A bit of forgot, but let's see. Spironolactone, androgen. Sodium loss to both would do. Spironol. Okay, one is loop diuretic and one is thiazide. So it would be magnesium. Uh, with spironolactone, no, not a thiazide. It is not a loop diuretic to reduce the potassium loss because it is causing hyperkalemia. Potassium is inhibiting the sodium and potassium exchanger. So potassium is not excreted, so it reduces the potassium loss. First time I'm seeing this image. Young male urethral injury, RTM. Supra. I have not done this procedure in my internship, but what I can see is suprapubic cystostomy is the answer. Because see, suprapubis, you are inserting this catheter. So it is a suprapubic cystostomy. Okay. area marked in the pink. Yeah, C1 area, right? So C is submental. See, your tears roll from the lateral side to the ears, like when you sleep, and from the medial side it goes below. So medial side of your eye is submandibular, and the lateral side is preauricular. Okay, Spalding sign first seen after 2 days or 7 days. 7 days, I think, probably 7 days after death. Spalding sign. 2 days within 12 hours. This is the Robert sign, gas in the aorta. Which of the following about extradural hemorrhage is false? In NEET PG 2023 also an image was given of extradural hemorrhage, but it was given in such a way that it appeared to be a subarachnoid hemorrhage. So extradural hemorrhage may be ruled out in absence of skull fracture. No, never, guys. A minimum of 35 may be correct. Ruled out in absence of skull fracture. So this is only false, right? Most common vessel, middle meningeal artery, yes. Least common traumatic membrane. Least common type of traumatic brain membrane hemorrhage. This is also not true. I'm feeling absence of skull fracture. I don't think it is the least common type. Don't think it to be the least common type. This is also a new question. Middle meningeal artery though is INI-CET's favorite topic. It goes through Terian because Terian is their favorite topic. So what lies below the Terian is the lateral sulcus. Uh, the sphenoid bone is forming the Terian. What bones form the Terian? So they are favorite topic. Terian is a favorite topic of INI-CET this year also. Previous year repeat is that what lies behind the Terian. So it was the lateral sulcus. Now, a minimum of 35 ml, least common type of traumatic brain hemorrhage. I don't think it to be the least common. I'm going with this. Okay, so this question, I think in our year NEET PG it came. You can see a prosthesis. Let's see what the question is telling. Who went laryngectomy mode? Okay, mode it's used is. So it is trachea and esophagus. So it is tracheoesophageal. Electrolarynx device would be there and it would be attached uh, in your trachea to generate the voice vibrations. It would be generating the vibrations, and it is tracheoesophageal because you can see that from the trachea the air is going into the esophagus. Bloomberg's prosthesis and all were there. A 50-year-old painful blister. So derma, I need not do any mistake in derma, being a derma resident. Painful blisters, okay. Erosions in the upper body. Blister and erosions are also there. Histopathological image. Let's see what's in the histopathology. Blistering disorder we can see. And number of Sang cells, I think it is visible. Okay, so it is more or less just subcorneal blistering. See, we can see all the layers of epidermis, so it would be Pemphigus foliaceus. Yes. Usefulness of a screening test is high sensitivity. High specificity is a diagnostic test. So screening test is high sensitivity. Okay, so you can type any questions you are having for me in the chat box. After solving all the questions, I would go to the chat box. And if any time is remaining in this session, I would try to answer them. And uh, I am Dr. Mayukh Hazra. You can check my YouTube channel also because I do give educational content regarding PG. So a 65-year-old vegetarian complaints of weakness, fatigue, tingling. So vegetarian could have folic acid deficiency, right? And feet. Physical examination, pale conjunctiva glossitis. Laboratory investigation shows macrocytic. So folic acid macrocytic, yes. Elevated levels of homocysteine, methylmalonine. Which of the following is okay. Thiamine, folic acid is not the case. Then wait, cyanocobalamin. Sorry, I was a bit mistaken. So folic acid is more present in the vegetables, and cyanocobalamin is more in the non-veg people. So he's a vegetarian. So this is a case of pernicious anemia. Pernicious anemia, I think more it is of a case of in case of pernicious anemia, it is autoimmunity. We tell it pernicious anemia, I think. On examination, level of consciousness was assessed. GCS scoring. Don't remember much. Let's see. With painful stimuli, eye opening, I think E2. Painful stimuli. If it was not opening at all, then it would have been E1. Level of consciousness was assessed. Painful stimuli, opening, withdrawal was seen. Inappropriate words. So it is V3. E2, V3. Oh, the two options are there. Motor, I forgot, man. So first is that it can obey and localize the pain, I think. Then it is causing withdrawal. After that, posturing, decorticate, decerebrate. So I think M4 would be the answer. A patient made a self-diagnosis of athletic food. Oh, okay, another dermat questions. Began using a product advertised on television. His condition improved but didn't resolve completely. This is a case of all the patients out there. So they apply everything, then after that they come to us. The patient then visited a dermatologist. A skin scraping was sent for culture, including a culture for fungal culture. Okay, so it is not totally dermat, it is going to microbiology. Few small microconidia. Okay, I have to see it afterwards once. Congenital disorder in microspherophagia. Wheel Marchesani to anterior lenticonus galactosemia not. Axenfeld anomaly and Axenfeld-Rieger anomaly. So both are closer. Now in two questions I am stuck, then I have to go for one, right? So Axenfeld or Axenfeld-Rieger. This is a difficult one, means with which I should go. Going with Axenfeld-Rieger. Axenfeld anomaly I am going for now. Marking for review. A 16-year-old boy has a thigh, there is pain. He denies of history of trauma. Examination reveals large, deeply fixed soft tissue, thigh mass. Okay. So laboratory investigations, elevated ESR, leukocytosis. A plain radiograph, MRI. So some ESR in Ewing sarcoma, I think it is more commonly seen. Diagnosis. How to zoom in, man? Okay. Biopsy, I can't understand actually. Let's see the age again. 16 years. I am going for Ewing's. ESR is raised. Fever is there. Thigh pain is there. So I am going for Ewing's. A 20-year-old patient complains of diarrhea. Diarrhea, okay. Abdominal pain. Blood pressure is raised. 2 to 3 days later, HUS, hemolytic uremic syndrome, I think. His platelet count is decreased. Yes, creatinine is high. On peripheral smear, normoblasts, cystocytes, Adam Thies normal, so it is not a case of TTP. So it is a case of typical HUS, I would say. Diarrhea after diarrhea and all it is developing. A 6-year old child with steroid responsive nephrotic syndrome. Okay, it is steroid responsive. He had received previously prednisolone. So steroid responsive following tapering of last week's week of prednisolone for last 15 days. Which of the following is true regarding his vaccination? I think in case of when there is immunosuppression, you avoid the live vaccines. Okay, only live vaccines why you would give. So only kill vaccines could be given, or else it could cause the infection if you give the live vaccine, right? Now, a 67-year-old patient was brought to the emergency room with a history of a road traffic accident. Now he presented with a pelvic fracture and head trauma. On investigation, his CT scan suggested a case of raised ICT. He was given morphine for pain relief, pelvic fracture, head trauma. Morphine, why would you give? Okay, so after that, he difficulty in respiration. Yes, you have done a negligence by giving morphine in a case of head trauma. Which of the following is most accurate? Could not breathe due to breath fracture. No, CO2 depression, respiratory depression, and CO2 retention due to opioid. Yes, this is the case. Morphine addiction, not a case. Gold standard investigation for coronary artery disease. So, coronary angiography, you find out the block. I think it would be the answer. PET scan is for stunning myocardium. Stress echo in case there is exercise induced angina and all you do. Which of the following muscles is supplied by inferior root of ansa cervicalis? So superior belly or inferior belly? Omohyoid. I think it is the superior belly. Superior belly. I think it would be. Would be the superior belly because inferior belly, I think in the back it is there. Don't remember much, but superior belly I am going with. Earliest manifestation of end organ damage in hypertension. I think visual. New kind of question, but I'm going for visual. Let's see all which I have left and all. Number. Yeah, meanwhile, you can something, if you have any doubt, you can ask me in the comment section, which I can answer in between the period. If I have some time left in this session, then I would be happy to take up those questions because I also need to shift my mind from here. I am not liking to sit for 3.5 hours, and I would love to have a talk with you all. A patient with tibial fracture put a cast. Okay, why I haven't attempted this? Tibial fracture put on cast presented on the complaints of pain in the injured limb. His cast was cut on examination. Passive flexion. So this is a case of compartment syndrome, right? Loss of sensation, dorsalis pelvis, neck space. I would measure the anterior compartment pressure, but when there is pain on passive flexion, then I should go for a fasciotomy. This also I am removing from marked for review. This one is a confusing one for me. No. Myelinated nerve. I think the time it is taking to excite, right? So it could be the answer. Let's see. Last would be the cardiac muscle. I think A, B, CDE. So myelinated nerve, then unmyelinated nerve. I think it would be smooth muscle in the last, myelinated, unmyelinated. The other option, cardiac muscle, would be in the last only. Myelinated, then unmyelinated. Highest excitability, unmyelinated. Then skeletal muscle, then cardiac muscle, then smooth muscle. I'm going for that one. 15 number. Which enzyme is deficiency most likely? Aryl sulfatase, it was aryl sulfatase would it be. I'm going with this one. Yeah, I'm leaving it. Let's see. Viewing from for review. C21. Klebsiella enterobacteriaceae, group B streptococcus. All are, I think, group B streptococcus. Going for that. So this has few microconidia. I had remembered this. I need to then guess one. What would be that? Don't remember it actually. Epidermophyton, trichophyton, trichosporum. I'm going to leave it a bit. Marking it 33. I'm going to mark for Riegler syndrome. Choosing. Okay, I'm seeing the chat once. 5 minutes is left. Sir, how is Chacha Nehru Bal? Means I can't give you idea about an institute which I have not done the observationship. So best thing is I would tell you that have a consultation with the seniors, and the best thing that you could do is you go there, see how the patient management is being done, and do an observationship. Means you for 1 or 2 days. That's the best possible thing. Even the seniors can give you wrong ideas, but if you see, then you are the one who is witnessing. Okay, I am a post intern. I am weak in medicine. I did okay. RR marrow for that marrow revision you did, and BTR should I stick on it? Means I can't name such other platforms. Still not getting confidence. So main thing how you can get confidence is by solving MCQs. Medicine is a holistic subject, so at first you have to keep your subject strong, like that of pathology, physiology, pharmacology. These all subjects you have to be strong with that, microbiology also. After that, medicine, anything you can study. You are studying a revision source, well and good. But if you are having confusion in certain topics, then consult those topics for the main videos. You go for that now, and the confidence would build up only by solving MCQs and getting the corrects. Okay, uh, the main booster of confidence is that when you win. So when you win and when you do more of corrects, then only you can get the confidence that yes, I am strong in this subject, yes, I am strong in this subject. So there would be times or there would be questions you are getting wrong. Now you have to analyze how you have got that wrong. Is it a conceptual error? is it just a factual thing? If it is a factual thing, you remember that, that's okay. But if it is a conceptual error and your concept is not clear, then go consult the main videos for your concepts. Or if any friend is there or any access to any faculties of your college, then you go and understand the topic. I think this sorts out the problem and your question also, Dr. Ankit. So 32 only left, 2 minutes still left. Any other questions in the live chat? I'm going to have my protein shake till now. Till then, how many of you have joined in the live session? How many of you have joined? Any other question? Now also 2 minutes are left. Actually, in this time that is left, you should go brush up through the questions like I am going to one. Means you have to review again that whether there is any mistake or not. And I am explaining you people. So it is taking a bit of time. It is taking a bit of time. But actually you don't have to explain and you read in your mind only. So the technique I tell is that in 8 minutes you do 10 questions. So in 32 minutes you have done all the 40 questions and 8 minutes are left. 10 minutes are left for you for the revision, right? So in those 10 minutes you revise again the answers. Okay, like this you brush up through the answers, because maybe you have done a silly mistake. It could happen, really, it could happen. Alzheimer's. And any other question you can ask me. Uterus septate, Kevorkian sign. This one a bit of confusion. First sign I think is the Kevorkian sign, right? Tachynoir is seen afterwards. I think Tachynoir is seen in 5 to 6 hours and all. Kevorkian may be seen in less than 1 hour. So I'm changing one answer during the review. So that's why you should do review. I don't know I would get it correct or not. And I'm giving the GT with live, and I haven't solved this GT, so I would share the marks also I'm getting after 1.5 years of practice. And if I get more than 500, then it is a good one. So, as per Mental Health Act 2017, a mentally ill patient decides who is going to be his caretaker. So, this is active directive or advanced directive. Now, a patient, chronic middle ear infection, headache, vomiting, neuralgia, CT scan, we can see an abscess. What is the probable temporal lobe abscess? Yes, these two are easy ones. Another derma. So, um, previous one was not derma, right? So, 5 dermat questions I'm getting. This is a case of pityriasis versicolor. You can see the white spots. Cases, there may be times you could see dark spots. Why it is called versicolor? Because various colors. It could be dark also, it could be light also. Why it is light? Because of the production of azelaic acid, which is a tyrosinase inhibitor in that organism, Malsasia furfur. And why dark? Because it causes melanosome hyper, means enlargement of the melanosome, so it can cause hyperpigmentation also. About 80% of the cases I see hyperpigmentation. 18% of the cases in my OPD I see 80% hypopigmentation, 18% I see hyperpigmentation, and 2% overlap, both are present. So pityriasis versicolor, no, incorrect statement now. Okay, nice. Scratching with nail exaggeration, exaggerate scaling. Yes, scaling would be there. Woodlam's examination shows yellow fluorescence. I'm forgetting a bit. Pseudo hyphae, yes. Recurrence is common after a complete course. Yes, it is also true. Mm, once I'm leaving it once for later. This image was also given. So this is a case of filariasis. So filariasis, two questions. Now disease has occurred. Now you are doing disability limitation. So disability has occurred. Now you are washing the feet so that it prevents your infection in the feet. A 30-year-old woman of Northern Europe ancestry presents with progressive dyspnea. Northern European, I don't know how it has relation. She denies of the use of cigarettes. Okay. History of sister having the same thing. Which on the etiology is most likely okay. So dyspnea, emphysema, deficiency of alpha-1 antitrypsin. Alpha deficiency, big answer. Among the following, the highest likelihood of developing pulmonary embolism as per Will's prediction rule. Signs of symptoms of DVT? I think so. Cancer, bit suspicious regarding this. Signs and symptoms of DVT I am going for. Coxsackie A virus may mainly cause all except hepatitis. Herpangina, though it causes. Conjunctivitis is causes episeptic. I think hepatitis would be the answer. I'm marking it for review, but maybe I'm not going to change my answer. Patient with localized alopecia, poilosis, vitiligo, depigmented fungal appearance. And depigmented limbal lesions. What is the most consistent diagnosis in this poliosis? What it is meaning? I don't know the actual meaning of poliosis. Poliosis syndromes are there. HLA-B27 leukocytis angspon is HLA-B27. It won't be the answer. Herpes simplex, so nowhere it couldn't be the answer at all. Alopecia depigmented function, Vogt Harada Koinagi. I'm going for it. Vogt Harada Koinagi, I think some ear impairment is also there, hearing loss, if I am not wrong. What is this? Which injury can result? Okay, okay. So slipped, pulled elbow. इसको बच्चे को पकड़ के रखा है. So he is pulling the elbow. Though in the image he is not pulling the elbow, means he should suspend the baby to be it pull elbow. So this is a case of pulled elbow. Which of the following microscopic finding in HPV associated squamous cell cancer of the cervix? Coilocytes. Coilocytes. Outside, where it is seen? Outside is seen in CMV, Mallory Denk bodies or Mallory hyaline bodies in case of liver we see. Today old child brought with diffuse swelling. So caput succedaneum and cephalhematoma. Diffuse is caput succedaneum. What is the diagnosis? Caput succedaneum. Cephalhematoma in my year NEET PG was asked with an X-ray. Here it was the hematoma. A 34-year-old male patient presented with mitral stenosis. Okay, mitral stenosis is there. Um, when I am solving the questions, meanwhile, you can throw any question to me. If I have time after solving this uh, session, means after this part, then I would love to answer your queries. He was admitted to the cardiology department and he had undergone a surgery. Pre-anesthetic checkup of him revealed increased levels of liver enzymes. So mitral stenosis is there and liver enzymes are increased. Okay. Which of the following inhalational agent is preferred in this patient? Halothane to causes halothane hepatitis. Enfluran also we don't use much, I think. Civo is cardiostable. Xenon is the best. Okay, xenon is the most ideal, but it is availability issue is there. So I think I would go with sevofluran. Which of the following are correct? I'm getting a bit of back pain for sitting too much long. I don't sit actually too much long. Ah. All of the following statements are correct regarding full thickness skin grafting except full thickness skin grafting is harvested to incorporate whole of dermis. Yeah, composite graft contains epidermis and only a part of dermis. Partial thickness it consists of. Full thickness graft requires careful handling, not that much careful handling. Composite graft, what it is saying, I can't understand. Composite graft, what it is telling, but part of dermis though in split thickness we take, so I'm going with that one. A patient with conus medullaris, cauda equina and conus medullaris. Okay, in the cone. Conus means in the cone, like the ice cream cone in the tail of the spinal cord. Which of the following symptom is not seen in this patient? Hmm, okay, bladder bowel involvement, lower motor palsy of lower limbs. I don't think so it would occur because in the S1, S2, S3 like that. So S2, S3, S4, the what is it is called pudendal nerve is gone, sympathetic parasympathetic innervation is gone, perineal anesthesia because S4, S3 region is in the perineal. Bladder bowel involvement would be there. Sexual function dysfunction would also be there. But why lower motility and पैर में क्यों जाएगा वो वाला? L1, L2, L3, L4 you have for the legs. An infertile woman endometrial biopsy. Okay, so in this year INI-CET also an endometrial biopsy image was there. Which hormone should be preferred? Proliferative. So it is proliferative. It is not the first is the proliferative, then is the corpus luteum phase. So I'm going for progesterone. Progesterone, then it would be the woman is having estrogen, so there is proliferative phase. Valid consent for sexual intercourse is it less than? Yeah, this is true that 18 years is the legal age for marriage, but I see patients who are having a child also in 18 years. So that should be considered as statutory rape. 20, this is molluscum contagiosum. Let's read the question now. Another dermat question maybe. Thank you for giving more number of dermat questions to DocTutorials because or else I won't be able to solve that much. A 28-year-old female has asymptomatic lesions on the face since 2 months. Okay, her daughter had similar lesions. Mainly, it occurs in the children. In some cases, adults may occur if adults are occurring. Maybe there is a contact is there, or if there is no contact, ask for sexual contact because I had seen a patient who had lesions in the inner thigh of molluscum contagiosum. So I asked that had you had any sexual encounter? So yes, he replied that she had. So maybe either sexual route or by the touch. What is the causative organism? Mollusky pox virus. Actually, we say it molluscum contagiosum virus or just pox virus. This option is, I would say, it is molluscum contagiosum virus would have been a better. Arey bhai, what is this? Standard deviation? I think standard. Oh, mean median, though not there, and it is not variation also. Variance also, I think. A pregnant woman is able to transfer oxygen to her fetus because fetal hemoglobin has greater affinity for oxygen. Yeah, than adult does. Why the affinity of fetal hemoglobin is more? Less ppg in fetal cell. So, tense form of hemoglobin is more prevalent. Biochemistry. Tense form of hemoglobin is more prevalent in circulation of fetus. I don't think it's so. Let's see. There is less 2,3 BPG in fetal circulation as compared to maternal. Fetal hemoglobin binds 2,3 BPG with fewer anionic bonds with adult form. ऑक्सीजन बाइंडिंग कर्व शिफ्टेड अगर राइट होता तो फिर तो इट वुड हैव लेसर एफिनिटी. So this is the answer. 2,3 BPG, it has lesser affinity to 2,3 BPG. Good question. Medication myasthenia gravis is very very important because in last 5 years more than 5 times it has come either in NEET or INI-CET. Which one of the following medication is relatively contraindicated in myasthenia gravis? Okay. Ciprofloxacin, it causes tendinitis. Muscle, anything it causes. Amitriptyline, it is causing inhibition. Metformin, in case of metabolic acidosis, we don't give it. Metformin. Ampicillin. Gentamicin and all we don't give. I would go for maybe ciprofloxacin. I would go for ciprofloxacin. I'm not sure, marking it for review. H1N1 is a type of this also. I am leaving it for now. And identify the type of hip fracture. Box fracture. No, I don't know the staging at all. I'm leaving it for now. Now the questions are becoming a bit of difficult. A 55-year-old man has been complaining of nausea, vomiting, dysphagia, weight loss for a long time, and a general examination is normal except signs of anemia. Okay. Upper GI endoscopy 3 into 3 in the antrum. Urea is positive. So this is a case of ulcer, I think. An image in the gastric biopsy. What is the most likely diagnosis? Vomiting dysphagia. So after maltoma, after it is causing cyst तो नहीं होगा, एडिनोकार्सिनोमा भी नहीं होगा, माल्टोमा होगा. माल्टोमा होगा. According to neonatal resuscitation protocol. So this was also asked in this year INI-CET. So we can see, I don't know, is the GT before INI-CET? I think I attended a previous GT. So it should be before INI-CET. So यहाँ से तो बहुत सारा questions common है. 2 से 3 को question INI-CET में. So 3:1 ratio में देते हैं. और chest to breath, sorry. 15:1. 30:2, I think, probably. A 59-year-old male patient was admitted to the emergency department for management of acute attack of asthma. His physician was treating with frequent administration of salbutamol nebulization. खाली salbutamol क्यों दे रहे हो? Which of the you should give a dose of steroid also. Which of the following adverse drug reaction is least likely? Tachycardia it can cause. Bradycardia, why would it cause? Hand tremors, hypokalemia, all it causes. It is used in the management of hyperkalemia. So it causes hypokalemia, definitely. Identify the condition. Is it hooded prepuce in case of hypospadias? Phimosis is not there. It is a case of hypospadias, I think. Hooded prepuce, yes, we can see the urethra also a bit below. So this is a case of hypospadias. So the prepuce is later used in urethroplasty. A 2-year-old boy reported to subcenter with complaints of fever and cough for 2 days. You notice chest in drawings. No, the respiration limit was there, right? I don't remember that much. So 1 to 2 0 to 1 month, I think 60. 2 to 5 months, I think 40. After that was 40. After that was 30, like that. So I have to see IMNCI guideline. Yes, this was asked in the question, but the limit actually I have to think. One so 1 to 0 to 1 month was, I think, 60 on something 60. Fast breathing, how you can 1 to 5 years. Normally we have 12 to 14. So less than 2 months was there. 38, I think it is not more than the limit. 40 is the limit. If 1 to less than 50, less than 40, less than 60, less than 50, then it is less than 40. So it is less than 40. So it is cough, fever, home treatment only I would keep. This is not a case of pneumonia. A 25-year-old married nulliparous undergoes laparoscopic cystectomy of an ovarian cyst. Ovarian cyst है उसमें laparoscopic cystectomy is done. Now reveals ovarian serous cyst adenoma. Now we should do bilateral serial CA measurement. Is it the operation going on and in the frozen section have they repeated, or serial CA measurement? This is a good question. Approach based question. Radiotherapy I won't do. Just radiotherapy, and yeah, A and B would be the answer anyway. I would go for serial CA measurement. I'm going with the concept that if it is more, then I can do any operation after that. So I am not going for a drastic measure, but I don't know if it is right or not. Which of the following statement is true regarding the postmortem finding of the lung due to asphyxia? Tardive spots. Due to rupture of capillaries, yes. These post spots are reliable indicators of asphyxial death, yes. Usually seen below the level of constriction. Ecchymosis limit is 2 millimeter. I don't think so. Ecchymosis, I think more than 3 millimeter. I'm going for that. What is this, guys? What is this? You answer. So a patient with concentric. This is a classical image, and I go to mediquizzes, so I know this image very much well because in mediquizzes this is one of the questions. So wood grain pattern. This is erythema gyratum repens. If you ask me without seeing the options, I would go for a case of pancreatic carcinoma. Another thing they commonly ask in quizzes that is not asked much in the PG entrance exam is Treeman syndrome or epidermodysplasia verruciformis, where like the trees you have the fingers. I mean, in the fingers you have much of papilloma. In discovery also they used to show that kind of patients like this kind of tree like hands and all. So that these two conditions I like very much, and they are too close to my heart. So see, the first option is only pancreatic carcinoma. Pancreatic carcinoma and other things you can see is the uh, neck nodes swelling. The, after that is the left subclavian and lymph node swelling, Trojan sign. After that is the sister Mary Joseph nodule also in case of pancreatic or stomach cancer, and migratory thrombophlebitis also you can see. In cases of lung carcinoma, you see lesser trellet sign, you see hypertrichosis and all, trippy palm in the palm. These are all images they could ask you in future. So false regarding a reference female of India. 19 to 39 is right. 162, I think weight is this time means age is okay. Height is also I think okay. Weight I am a bit suspicious. I think it is 55 kgs. I'm going for weight. अरे बाप DNA polymerase. Diagnose xeroderma pigmentation. Xeroderma pigmentation is nucleotide excision repair. Long history of skin cancer. See, xeroderma pigmentation was two questions. One was from the dermat diagnosis and one from the case of the means biochemical defect. In past 6 years, he had 30 neoplasms unexposed. Enzymatic defect, so it is excision repair. ये पॉलीमरेज का डिफेक्ट से तुम्हारा कोई ये नहीं होता है, नथिंग ऑकर्स इन केस ऑफ जेनेटिक डिसऑर्डर्स. Base excision repair is there. Like in HNPCC, mismatch repair is seen. So M for N, mismatch repair, HNPCC, like that. A 52-year-old woman presents with complaint of left foot pain. So left foot, there is pain. She was awakened from uh, in the night due to intense pain near the left great toe. So is it gout? Medical history is unremarkable. Physical examination reveals erythema, warm swelling, first metatarsophalangeal tenderness. Which of the following test will provide the most accurate diagnosis? So synovial fluid analysis. First thing, if they ask you, you can go for serum uric acid level, but it is the question is most accurate. So you would see needle-shaped crystals of monosodium urate. In polarized microscopy, you see needle-shaped crystals. Which of the following does not follows Koch-Uncle's postulate? So Robert Koch, he won the Nobel Prize in the third year of Nobel. I think in 1905, I was going through the Nobel Prize winners. So first was I think in first winning the first four, Niels Reiler was there in the second or third because he discovered lupus vulgaris. He is the only Nobel Prize winner from our derma skin. Which of the following pathogen does not satisfy Koch-Uncle's postulate? So it is the lepra bacilli. They are not cultured easily. They are cultured in foot pad of mouse. So lepra bacilli has a long generation time. That's why you see the leprosy infection occurring and manifesting after 10 to 20 years. Flipping, flipping. So aids in recognition of ESI. I remembered it when I was during preparation. I have it in my notes also. But ESI, ESI, I'm going for phosphatidylcholine. Enzyme inhibitor like omeprazole can interfere with the activation of which agent? Hey, bhai. Does it affect? Does it affect activation? Omeprazole was C19 to C19, I think. Clopidogrel or prasugrel? I'm going for prasugrel and marking it for review. Would think of it. STK 11. So you can memorize this STK 11. by the simple trick that 11, so it occurs in the 11 years of age. So this is a, oh, this is also an INI-CET question. By the way, STK 11, the matching was given, and SMAD 4, it occurs in case of the polyposis that occurs in child, hematoma. So in case of child, you see the juvenile, you see SMAD 4. So in 4 years of age it occurs, so SMAD 4 juvenile, and in 11 years of age it occurs, so PJS, Peutz-Jeghers syndrome. Gardner syndrome, I think osteomas are there, HNPCC, colorectal, polyposis more than 100 you can see. Cowden syndrome, there are facial features also in the Cowden syndrome. Cowden syndrome, there is increased risk of malignancy of the pancreatic tissue, ovarian cancer, breast cancer. So many are increased in case of Cowden syndrome. And let me remember the gene, if I remember. Mm, याद था भाई, काउडन का P10. Yes, Cowden is P10. So a female with an ovarian mass of 6 into 6 into 6, she shows reveals solid structures in the mass. So solid structures, if it is showing, it is moving towards malignancy. Our serum biomarkers are all in the normal image. ALP is elevated, the most likely diagnosis. अभी तो थोड़ा सा भूल गया हूँ. Teratoma shouldn't be that. Endodermal dyscharminoma is same as that of seminoma. So seminoma में तो नहीं होता है. I'm going for endodermal sinus. Let's see. Treatment of snake bite. Okay, so you all should know. Firm bandage except to occlude lymphatics. You can do lymphatic incision over wound, never reassure, immobilize. Yes. Saint Anthony's fire, characterized by burning pain, claviceps purpura. Claviceps purpura, cocaine, drug, Clostridium botulinum botulism, Arbus precatorius, not claviceps purpura. Okay, so I have completed the 40 questions. If you have any questions, you can definitely ask me, because I am having a bit of time also. Anything not related to studies also you can ask. Anything, if you are having any problem related to the preparation, any sort of thing that is hampering your preparation, be it your personal life, be it your psychological issues, I would be happy to answer. Identify the incorrect statement. Oof, so much of sitting down, it is only taking a toll on me. Hmm. A bit calming of my mind with deep respiration. In case of you are having any panic attack during the examination, do the deep breathing. Inhale 3 seconds and exhale 3 seconds. Like this, if you do few cycles, then your mind would calm down. So let's see which all questions I haven't attempted. So scratching, which is not incorrect. Scratching, hoga, ruled out. Foot slam, I am not remembering right now. Keoids, pseudohypomalacia furfur, it would show meatball in spaghetti appearance. So spaghetti is the all the things you would get. Recurrence is complete. So I would go with the fluorescence only. Recurrence is common. I see many patients. Coxsackie A, I am going with hepatitis. Voktharaga Koinagi, I am going for it. Okay, I see the comments once. मजा आ रहा है सर. ओके, थैंक यू. और ये मजा मैं सबको देना चाहता हूँ. Protein shake you use, I use Muscle Blaze only. And second year, how to prepare from second year, if you ask me, then I think according to me, second year is the ideal time to join any kind of coaching if you are willing. And starting the preparation for NEET PG and INI-CET preparation, first year is not the ideal time till now. First year you should focus on the standard textbooks. Second year you should focus on the standard textbook. Along with that, you should go for a coaching. In the coaching, what you would do, second year subjects, and with that first year subjects. So you have done the second year subjects, you go through all the notes. After seeing the notes, you go and study the same topic from your standard textbooks, that is the Robbins and the KDT. And in microbiology, you can go for Apurva Sastri. So when you see the notes, it would be, after you see the notes and you visit the books, then it would be a cakewalk, literally a cakewalk, because the if you are learning from a good faculty, then he would make you understand all the concepts, and he would also highlight the important points. Now you read the standard textbooks. Reading standard textbook is very much important, not just for the PG perspective that they give images and diagrams from the standard textbook, but also you should have the habit of reading standard textbook. That habit is a major thing, because in when you are going to do PG also, you have to read standard textbook. So that reading of standard textbook is a must. And if you want one book that you should read, then that is Robbins. And you shouldn't miss any of your practical postings. Everywhere in Quora, I always write that you should attend the practical postings. And this year, the inoculation loop, how is it sterilized, it was asked. And INI-CET literally asks 2 to 3 questions from your first and second year practical. So you should not miss the practical classes. Now, how you prepare for second year? I used to prepare in the just last 2 to 3 months of the professional exam. I used to see the past year questions. This would give you an extra edge over others. You would have good concepts, you would have a PG preparation, and you would not miss for the MBs also. Question number 38. Let's see. Wait. 38. I am actually, I don't have that much idea. Okay. I have forgot, means see, literally I am doing this practice after I have been in culture for 1.5 years. I am not in this culture, so I can't tell you means exactly. But the thing is that CA 125, I think it is a marker for mucinous cystadenoma. Teratoma could be that. I am not sure. Dysgerminoma to HCG and all would be limited. I'm not sure about this question properly. Now, practical strategies for batch 2021. So 2021 means you are in third year, right? So in third year, what you should do, in second year you do first and second year subjects. In third year you should do third year and final year subjects. All the subjects you should have completed. During the final year you should do the revision source, and during the internship you just need to revise and just need to give the grand test. Okay. How can we motivate ourselves when we fail to achieve our daily targets? See, daily targets are made in such a way, and it is universal, that no one achieves the daily targets. So you have to make daily targets in such a way that if you are having a schedule, like in my YouTube videos also, if you see, if I give a schedule, I keep few days extra, because the daily targets are not going to meet. You may have some emergency, maybe you are having ill health, or you are falling sick, so your daily targets are bound to fail. This is a part and parcel of your life. The consistency is the main thing, that you are doing at least 6 to 7 hours of study. Means I used to do 6 and 7 hours of study, along with my internship duties. When the duties were hectic, that much I couldn't put in. So if you do practice, and if you are going to see the results, that your GT, when is the grand test, and you are seeing that your GT performance is improving, then that is the best motivator. I feel your result is your best motivator. Let's see all the questions again. 8 number. Walked Harada Koenagi. I'm going for it. 20 number. Ciprofloxacin once amitriptyline. Why would it be? H1N1. So H1N1 is swine flu. I think it would be influenza E. Influenza A should it be? Influenza A only. H1N1. So it should be influenza A only. I'm marking that one. So 20 number, I haven't removed the mark for you. I'm removing it. I can't do. Literally, I can't do. This I'm leaving it now. Once I am having water, okay. I'm taking a bit of water. Stay there. Stay if you are enjoying, and you can ask few questions also because. Okay, I'm going to take a bit of water. In 1 minute, I am coming. Hey, hello guys. Okay, how much time I have? 2 minutes. Next question, sir. How we can motivate? Okay, sir. How have we our final prof exams? How we have our final prof exams now? How to prepare from the start of internship? Yes, now you can focus on final props. Means I used to focus during my final props. Also, I was taking my revision notes. That much dedication I had towards PG. But still, after that, I was a topper in prof exams also, because if you have the core concepts right now, and one thing I used to do is that I used to answer questions in the Instagram. Many of you had seen that. They told that he is just showing off knowledge, but later when I made the rank, then they realized that yes, I was doing it to revise my mainly my final year exam writing practice. So these are all the things that if you see a question, if you describe that, then only your final year exam writing practice would be also there. And internship, as I said, that all subjects should have been completed. Revision notes you should have. Revise it multiple times. First two readings from the main notes. After that, go for the revision notes. All the strategies in my YouTube channel, you would get many n number of videos in my YouTube channel. You can see that. And giving the grand test. Final year subjects. Wait, let me see how much time left. 1 minute. Okay. Final year subjects except medicine and my third year is about to end. Okay, you are good to go in the final year. You do the medicine and revise all the subjects. Main videos plus Q bank enough with regular GTs? Yes, it is enough. But can you remember that much vast source? That is the question. First two revisions you can do from the source you are mentioning, but after that you should switch to revision source if you want an average IQ, like, or maybe I have a bit of more than average IQ. Me means I am not the most intelligent guy, so I feel revision notes is required for me. For INI-CET mainly focusing on the topic, so you read the topics list. Okay, I have given a topic list also, you can see that video. So those topics you revise multiple number of times. Which college to mobile, prefer Mumbai college, or if you are from Mumbai, people from Mumbai don't leave Mumbai actually. I've seen that all the toppers you see all the toppers, Manav Shah during our time, they generally don't leave Mumbai. So you can go for Mumbai, or if you are from Mumbai, or else peripheral names. BMW, अरे भाई ईयर दे दिया, 1984 maybe. It's not 1998. It's not 2000, 1991 or 1984. I would see it later. A patient on metoprolol, and if he is given verapamil, तो block हो जाएगा ना. Both are blockers. AV transmission. What is the effect? So bradycardia following AV block. Sorry for the call. What color coding bag is used to dispose contaminated gloves? So if it is contaminated with blood, then I would go for yellow, definitely. A muscular 25-year-old male presents with dermatitis and inflamed tongue, beefy tongue, vitamin B12, means B2. Okay, so he had raw eggs, so biotin by avidin as a part of training regime. कौन बोलता है क्या पता? Which vitamin is deficient? Biotin carboxylation. Biotin is deficient because the biotin is combined with the avidin of the egg. Egg means if it is not cooked, biotin deficiency it causes. A software engineer presents with fatigue, sedentary life, mostly sitting like me. He is sitting in front of the computer for 12 to 14 hours. He takes junk food, not eating vegetables. So this is a case of vitamin B12. No, sorry. This is a case of folic acid deficiency because folic acid is mainly present on in the vegetables. Vitamin B12 is mainly present on the uh, in the non-veg food. You can remember by cyanocobalamin for carnivores. Those who are carnivores or eating non-veg, for them it is vitamin B12 that is not deficient. Irradiation can be used in sterilization except bronchoscope. Though I think we do the glutaraldehyde, so I am going for bronchoscope. Which of the following is a telltale sign of free radical injury? Lipofuscin. Image-based questions are also asked from lipofuscin. So, lipofuscin. Which of the following is the most accurate reason for the discontinuation of POP? Okay. Thromboembolic events with more with estrogen, I think. Dysmenorrhea, breakthrough bleeding could be there. I am leaving it for the rest. Which of the following is a feature of raised intracranial tension except blurred vision? Yes, it could be seen. Cranial nerve palsy? Yes. Papilledema. Headache that worsens on standing. Why would it worsen on standing? I think this could be the answer. I'm marking that. Which of the following is indicated? Die. Normal pressure and the mnemonic is die. So dysarthria, ataxia, incontinence, or dementia. Dementia, yes. Cognitive decline, coughing won't be there. Gait disturbances, ataxia, incontinence, die. A 32-year-old pregnant woman presents with severe itch, particularly in the palms and soles, without any rash. No evidence of primary lesions. Most likely diagnosis is PUPP. What happens is in the stria, the lesions develop. This is not PUPP. This is probably cholestasis of pregnancy. Atopic dermatitis, not only palm soles, other lesions, and why a pregnant woman would only develop atopic. So it is unlikely. So this is cholestasis of pregnancy. Pemphigoid gestationalis, it is a blistering disorder. So no blisters are there. So it is also ruled out. Don't know. I'm marking for just a guesswork. I'm marking for 5,000. I don't know. अरे भाई इतना population कहाँ से आया? Usha. Usha is for, I am not marking this. I don't have any idea. Many genetic diseases such as cystic fibrosis and sickle cell anemia can be diagnosed by detecting restriction RFLP. Which of the following is most likely to be used in an RFLP analysis? Restricting the fragment length. So if you want to restrict, then dideoxy, both dideoxy acids you can do. Okay, so uh, when only the chain would progress, it would stop there, right there, dideoxy, because both deoxy, so the chain cannot elongate. Sanger sequencing it was used in. Most specific diagnosis of limited cutaneous, so it is anti-centromere antibodies. Anti-ROLA is seen is ROLA, that is when RONA doesn't comes or TS doesn't come, it is Sjogren. Anti-nuclear ANA is seen in ANA and Smith is seen in SLE. A 52-year-old diabetic male presented with palpitations, discomfort, PP is itna normal range, discomfort, and which of the ECG is shown below. Hey, where is the ECG, man? How I can answer? There is no ECG, right? How I can answer this? Palpitation is chest discomfort. I'm guessing this is a case of PSVT. If it is a case of PSVT, I would go for adenosine, right? But how I can mark without an ECG? So this question is unsolvable. A patient presents with watery diarrhea after seafood ingestion. Vibrio parahemolyticus, I think, after the seafood poisoning. Vibrio, just going by intuition. I don't remember much. 30-old with Kawasaki disease in ICU with severe sepsis. Okay, he's having sepsis also. His peripheral smear shows blue cytoplasmic inclusions. Dole bodies, I think. Neutrophilic inclusions are dole bodies, probably. Now I'm going by intuition. Sixth sense. A 58-year-old obese woman complains of postmenopausal bleeding. Okay, after menopause, so there is bleeding. There is no enlargement of uterus. Cervix appears to be normal in pelvic examination. TNC and biopsy shows findings consistent with adenocarcinoma. Which one of the following most likely contributed to the development of malignancy? HPV infection is causing, it affects only the squamous cell, so that won't be the answer. Adenomyosis is a benign condition where the tissue is going and settling in the myometrium and all. So it is also ruled out. Endometrial hyperplasia should be the answer. Chronic endometritis, none of the history is there, and chronic endometritis would most likely cause Asherman syndrome, or if there is curettage, it can cause Asherman syndrome. So diabetic female, you have decreased the HbA1c. It is in the control range. Up to 7 is control. After a few weeks, medicine, she complaining of itching vulvovaginal area, suspecting mycotic infection. So UTI is caused by SGLT2 inhibitors. SGLT2 inhibitors means hot favorite for the INI-CET and also NEET PG. And another question is that it causes more of limb loss. It causes increased limb loss. It also causes an increase in UTI because the glucose is excreted. Glucose is being utilized by the bacteria. They feed on the bacteria. The bacteria feeds on the glucose. That's why it is causing UTI, urinary tract infection. And in case of liver disease, you go for, in case of renal dysfunction, you go for linagliptin because L for L, liver. So linagliptin question was only asked 5 times in the INI-CET. So canagliflozin. Linagliptin is not from SGLT2 university. Canagliflozin, yes. Which among the terminologies denote the transplant of graft between the species? Between species, different species. Allograft, autograft, xenograft, I think. Which of the following does not supply? Okay, let me check. How many are watching now? Which of the following arteries does not supply the breast? A first year question, right? Intercostal arteries would supply, subclavian artery, why shouldn't supply? Actually, internal mammary artery, mammary is in the name, would supply. Axillary or subclavian? Axillary artery would supply, axilla is near the breast. So I think subclavian artery would be the answer. Following is risk factor. So much time I am having in this session. Okay. I am getting tired out. Means without session, I would have finished a bit earlier. This is the first time I think I am giving no means in main exam I haven't given this session based approach, so this is also a new experience for me also. Which of the following is a risk factor for placenta accreta? Maternal age, previous cesarean section, because cesarean section then only within the tissue it can go, so cesarean section. Which study is best for the assessment of unknown or a new disease with no etiological hypothesis? Comment I hate a bit. So cohort case control. Cohort you are doing or following them. Cohort won't be the answer. Cross sectional won't be the answer. Case control would be the answer. Maybe you are finding the etiology from that. I'm marking it for you once. A post-operative patient on IV fluids develops lesion on mouth, angular stomatitis. Urine analysis shows excretion of 15 riboflavin, riboflavin, creatinine, which abnormally low, which is riboflavin by creatinine is low, means riboflavin is low. Okay. Which of the following TCA cycle enzyme would be the affected the most? Humerase is not the answer. Citrate, I'm totally tired actually. So isocitrate dehydrogenase, I think it would be the answer. Succinate dehydrogenase. Alpha ketoglutarate dehydrogenase is there. Alpha keto. Succinate dehydrogenase, I think it is inhibited by the malonate and it is not utilizing. Isocitrate dehydrogenase in AD, it is being utilized, I think. Isocitrate dehydrogenase should be the answer. Maybe. Means all the multi-enzyme complex it is asking. Mainly in the questions, they ask the alpha ketoglutarate dehydrogenase among the TCA cycle. So this is a bit new. A 30-year-old woman comes to your office. She appears healthy and not limited by physical activities. She says she has occasional chest pain. She has occasional chest pain. Along with that, she appears healthy and is not limited by physical activity. She says that she has occasional chest pain often The change in position. Okay, so change in position. Her blood pressure is 110 by 70 and her heart rate is 76 normal. Auscultatory finding mid systolic clicks apex that radiates to her axilla. Which one of the following? Mid systolic aortic regurgitation, Austin Flint. The dynamic physical examination findings would confirm your suspicion. Oh, okay, mitral valve collapse is only to see. Would confirm. Standing, no change, no. Passive leg rising makes clicks murmur occur earlier. Leg rising should be the answer because if the venous return is increased, leg rising, squatting if we do, so the diastolic pressure would be means the resistance would be increased in the arterioles. No change won't be the answer. Squatting maneuver click occurs later. Diastolic. I'm marking it for review. In acetyl P benzoquinone mean causes in a PPQI, it is which of the following causes food poisoning in 6 to 8 hours, 7 hours? So, Staph aureus causes, Clostridium causes, Bacillus cereus causes, E. coli would be the answer. I think. Which one of the most suitable for drought resistance HER2? Lapatinib, I think. Lapatinib. Wait. Sorafenib, Erlotinib. These are used for. I think the cancers. Lapatinib should be the answer. I think this was in INI-CET question also. Most frequent cause of hypothyroidism in iron replete population. Iron replete. So it is chronic lymphocytic thyroiditis or Hashimoto thyroiditis. Which one of the develops from the parathyroid gland? Which of the following pouches? Third pouch, third and fourth pouch. Gestational. Pregnant woman is diagnosed with gestational diabetes mellitus. What is the initial management strategy? Lifestyle modification, I would advise at first. While oral hypoglycemic agents are contraindicated in case of pregnancy, only insulin you can give. Why would you observe just lifestyle modification you give? So, 50 people suffer from cholera in a population of 5,000. Out of 50 patients, 10 died. Total death are 50. Calculate the death rate. किसका डेथ रेट सब चीज का मिला सो per thousand population. So 50 by 5,000. So 50 by 5,000 means it is coming 1 by 100. It is 10 per thousand. I think it is coming 5,000, 1,000 and 10. 10 per thousand would be the death rate. A 45-year-old man is brought to the emergency department unconscious by uh, emergency medicine service. His wife reports finding him unresponsive in their garage. He was running a generator due to power outage caused by a recent storm. On examination appears cyanotic. His skin was cherry red in color. Arterial blood gas So this is a case of carbon monoxide poisoning. So carbon monoxide mainly inhibits the electron transport chain. So oxidative stress induced, no. Direct neuronal toxicity, no. Inhibition of cytochrome oxidase. 80-year-old women, exertional dyspnea, chest pain, syncope, these all are looking classic of aortic stenosis, syncope, chest pain. So on examination, this is the pulse. Apex bit is a bit shifted laterally. Mid systolic murmur. So during systole, yes, in the right second intercostal space, but right second paradoxical split is 2. Okay, right second means it is the aortic area only. So this is a case of aortic stenosis only, as I had guessed. As I said that you should guess the answer, then you add on the points and see what the answer is coming out after all. A person benzene to is causes blood cancer. Benzene causes blood cancer. Bladder cancer, benzidine, I think. A 25-year-old man with a history of 3 weeks of fever, tricuspid vegetation. So in the tricuspid valve, there is vegetation. Patient presents with is at IV drug abuse. So what is the most common? Okay, okay. So I think it is step one. Step four, yes, I think. What to worsening of heart condition? Type 2. In heart condition, SGLT2 inhibitors. C. I had said you that it is a hot favorite and liraglutide has come again. Liraglutide, liver condition, I think. Heart failure, reduced ejection fraction. Oh, acha. Vitamin. History of diabetes mellitus. She was brought to the emergency department with worsening of heart condition. Antidiabetic drug most suitable for heart condition. Canagliflozin, dapagliflozin. Among these two, Cana or Glafa? Dapa, I think. Going for Dapa. Which strain of human papilloma virus is responsible for head and neck cancer? Hmm, I'm leaving it for now. I have a lot of time. Damage control surgery except criteria for damage control surgery. Hypothermia, coagulopathy, serum lactate, not urine output. This is the normal urine output that is more than 1 ml per kg. Okay, I haven't mentioned. Okay, guys, give me a minute. I'm going once in the washroom. 1 minute. Okay. 1 minute. Hey, hello guys, I have come back. Now, if you have any questions, you can ask me in the live chat. I would try to answer some questions. BM, this I'm giving to Ka. Okay, 1984. I don't know. Progesterone only contraceptive. Progesterone only contraceptive. Most accurate reason for discontinuation of progesterone only contraceptive. I think it would be breakthrough bleedings. For that. Going for that 13 number. I don't have any idea. 14 number. Without X-ray, how I can answer it, right? Squatting increases the resistance. So I think there was exception, right? MVP and the HOCM was an exception. HOCM, if we do squatting, then it increases the resistance. I think it would be squat, because passive leg rising, I haven't heard anything of such. Okay, I'm not marking it for review. 39. HPV 1, 6, and 11 mainly causes the cervical cancer, right? Maybe HPV 16 I'm going for. 2 questions are left in this session. Okay, I'm coming to the questions. What if I have not started final year subjects except medicine, and my third year is about to end? Then what you would do in the final year, you try to complete all the final year subjects as soon as possible, and also a source of revision. If you are not extraordinarily talented, then you need to have a source of revision. Now you are seeing the cutoffs being rising because there are better source of revision coming up, and we all know that our brain cannot have that much of information, so a revision source is required. From final year, from internship, if revision source is left, complete the revision source and give more and more grand tests. That is the advice. And actually the scenario of medicine means academically excellent also. um, uh, the scenario of uh, in this country is really gloomy, like you are hearing attacks, and also the earning prospect is not that much great in case of medicine. So means, along with, except the NEET PG advice and INI-CET advice, I would tell you that like a canopy you spread. Okay, don't go just in one direction in the rat race. You can go for MBA, you can go for outside practice also. If you are not willing for PG, you can go to the peripheries and you can earn a lot, because in the peripheries there is a lot of vacuum there, and you can easily earn 3 to 4 lakhs per month if you are just an MBBS also. So means you give the exam, you should have the target. But if it doesn't work on now, then don't feel shattered or don't feel that your life has ended. You have a lot more of possibilities. Like a canopy, you means you have possibilities. MBBS is not just a one line stream. PhD after MBBS, no. mm, I think in foreign also you need to do an MD. After that you can do PhD. Inject 3K rank. INI-CET, okay. INI-CET 3K rank. What to do next? So INI-CET 3K rank, it is a good rank, but if you are going for clinical branches, it mainly exhaust in the 1K rank only, all the clinical branches. So anesthesia, if it is possible, it may happen that you can get anesthesia. And nuclear medicine, AIMS Delhi, you can get about 1700, 1800. Pre and paraclinical subjects, if you want to take, you can take, or else you have done a great rank in the NEET PG, you would further improve only. So see your GT progress. I think magic would happen. Actually, it's not magic also. It is the definitive progress that would happen. 11 minutes are left. Okay, I'm seeing my questions once I'm question. So from one, this is totally guesswork I had done. This is the block, both are blocked. Now contaminated, so in the yellow I would dispose. Egg, avidin, biotin. So biotin would be the answer. Sedentary lifestyle, fatigue, MCB, high megaloblastic anemia, not eating fruits and vegetables, folic acid, folic F for F, folic for fruit, cyanocobalamin for carnivores. Okay, C for C, F for F. Like this, you remember. Irradiation, bronchoscope, glutaraldehyde, lipofuscin, sure, lipid peroxidation. Which of the following is accurate reason for the discontinuation of progesterone only contraceptive? And I'm going for breakthrough bleeding only. Why should a headache worsen on standing? I don't know. Not in triad is coughing. Why would coughing occur? This I had explained why it is not PUPP, why it is not atopic dermatitis, and why it is not pemphigoid gestationalis. This I don't have any idea. I have marked randomly. This I have no idea, so I haven't marked at all. So two questions I have not marked. Dideinoxynucleotides. Anti-centromere antibody. Shall I mark anything? So if I see palpitation is there, BP is normal, they are showing. So PCI is highly unlikely. In PCI, why would he have palpitations? Means case of MI, he would have chest pain. So I'm ruling out that option. TC cardioversion could be there, but TC cardioversion won't be that option because he is hemodynamically stable. Amiodarone infusion in case of CPR. So I'm going for adenosine only because I think that the image would be that of PSVT, paroxysmal supraventricular tachycardia, hot favorite topics, multiple times repeated topic. So in paroxysmal ventricular tachycardia, what you do is at first, if the vitals are stable, in any case, in any heart condition, if you see vitals unstable, then just give a shock. If vitals are not stable, now in case of paroxysmal supraventricular tachycardia, you first give the jugular venous massage. Okay, you increase the bradycardia, you increase the vagal tone, and you try to all block the supraventricular tachycardia. After that, adenosine. I have used adenosine during my emergency when I was um, uh, JR at emergency medicine. Just after my giving my PG, I joined as a JR before the counseling was starting. So it has massive result. Means within, it has a half life of a few seconds, and within seconds you see a PSVT ECG to a normal ECG. This is one of the magics that happen in emergency. Truly magic if you see that. But I don't know whether it is the question or not. Another question that is hot favorite is the atrial fibrillation. If there is valvular abnormality, then you go for warfarin. If there is no valvular abnormality, then you go for NOACs, novel oral anticoagulants. So seafood poisoning, Toll's body. I'm going whole jolly, Pappenheimer, Haynes body. These are not. Hyperplasia, canagliflozin. If I get more than 500 also marks, now that is a great marks for me, I think. Because after 1.5 years, if I get 150 corrects, I would share with you the rank and all. I would try to share. Which of the following arteries? I would share on my YouTube channel only. Which of the following arteries does not supply the breast? I had marked subclavian. Okay. Previous cesarean section, risk factor. Unknown disease with no etiological hypothesis. Going for case control, I am not going to think it over. Isocitrate dehydrogenase. This though I have what is in paracetamol poisoning. All except coli. Yes, lapatinib. This is most frequently hypothyroidism. Actually, I'm not giving the exam, but if I give the exam, I would see each and every line again while you are doing revision. So this is Hashimoto's thyroiditis. Two questions regarding thyroiditis at one. Parathyroid gland, third pouch, lifestyle modifications. This was a confusing. Means they tried to confuse by cholera. So they are just asking the death rate. They are not considering the disease specific death rate. So this is just for confusing you people. Cytochrome oxidase, it inhibits aortic stenosis, syncope, occupational cancer, blood, benzene B for B, staph aureus, dapagliflozin, HPV 16, damage control. So I have 5 minutes left. Any other question? Pro SC 2.915K MB. MD medicine, yeah, maybe possible. Maybe possible. I means I had shared, I think, one video regarding the caste wise, also category wise cutoff. So you can watch that video on my means YouTube channel, Dr. Mayukh Hazra. You can go and watch that video. I don't remember actual stats, so you can go watch that. USMD is equivalent to MBBS. Yeah, actually not equivalent. They don't have any degree such MBBS. They directly do MD and they give the degree. They have only specialist doctors. Any other question? And I would like to advise you that along with studies, you do extracurricular activities also, because the mental pressure, how to stay fit means physically fit or mentally fit or academically fit. What you are asking, kindly specify. Physically and mentally. Physically, you do any kind of homework. Okay, physically. So any kind of home workouts you can do. I used to do till my NEET PG exam. I used to do mostly the home workouts. After that, I joined the gym. Mainly, if you want to see a shredded look, then diet plays a great role. I have seen that. Along with gym, you have to control the diet, or else you are going to gain fat also. And if you are going to gym, if you leave anytime, then you are going to get massive weight gain. Massive weight gain. So you have to continue. Okay, you start once, you leave once. That won't be. Make it your habit. Inculcate in your daily routine, because I have seen massive result, not just um, physically, but in the academic performance also. Academically, it boosts literally very much. It boosts your mind setup. Means the endorphin rush that it gives you is the feeling of satisfaction that it gives you, the feeling of well-being that it gives you after the exercise is unparalleled. And I used to do my exercises after in the evening session when my mind used to drain out. Then I used to do the exercise and I had a again fresh mindset. Previously during my before my MBBS exam, I had very lack of concentration, and I think these exercises had helped me a lot in improving my concentration. I go to gym at 6 to 8, means 1.5 hours I do gym now. Yeah, you can manage gym and PG preparation also, but sometimes you have to cut down a bit. But even During my NEET PG also, before the NEET PG day also, I did some home workouts. After that only I went. Or else means I have withdrawal symptoms also. Many people don't have, but if I don't do workout for a day, then I feel literally headaches. So I literally have headache. That is a side effect, I think. But it is a good practice. And mentally, if you want to stay fit, these physical activities would help you. Along with that, do some kind of meditation or mantra chanting or any kind of activity you can lean down to spirituality in your religious path. That also gives a lot of mental stability, I have seen. How much time is left? 53 seconds are left. Okay, guys, I want to know that are you enjoying this session? Have you attended any previous sessions? And is this session a bit different with me? Am I a bit different from others? You are enjoying a bit more than others? Then do let me know. It is a long session and it is not possible to stay connected for 3.5 hours actually. It is better that if you see the video after the session, then you can switch to 2x. But are you liking the session? That you can give me as a feedback. Okay, so next session has started. Exposure to female fetus to androgen in early embryogenesis may arrest differentiation. Embryogenesis of Mullerian ducts. Paramesonephric duct is the Mullerian duct. Mullerian duct anomaly it can cause, yes. Mullerian duct. Mullerian duct is the paramesonephric duct. So Mullerian duct abnormality it can cause. A 25 or 24-year-old nulliparous woman is active labor, singleton fetus in cephalic presentation. Okay, good presentation. Continuous fetal heart rate monitoring reveals persistent late deceleration. Early deceleration is good. Late deceleration. Late deceleration is a sign of how many weeks? Weeks is not given. Late deceleration is a sign of ominous sign. Fetoplacental insufficiency. Most appropriate management. So I would go for I think emergency cesarean section. Singleton, but how many age fetus? Yeah, is not given. Lifespan of mosquito. How do I know it, man? Lifespan of mosquito maybe 5 to 7 days or 2 to 3 days. I am a bit confused. Okay, 5 to 7 or 2 to 3. 5 to 7 or 2 to 3. I would mark it a bit later. A 28 female patient presents to the emergency department with severe abdominal pain. Okay, nausea, vomiting. She reports that these symptoms are suddenly yesterday evening have been progressively worsening. On examinations, she appears to be uncomfortable. Okay, with a wreathing pain, abdominal, diffuse tenderness, guarding. So, case of peritonitis, maybe, especially in the epigastric region. Epigastric, okay. Tenderness, neurological examination, unremarkable. Increase. Oh, okay. So, this is a case of acute intermittent porphyria. You should always keep a differential. Means our biochemistry teacher in class in our college always said that acute intermittent porphyria is always a differential diagnosis when it comes to pain abdomen. So yeah, good question with a twist. I was thinking of peritonitis. Charlie, caused by transfusion of Trolley mainly PRBC transfusion only we are seeing massive hemorrhage. I think in all of the above it can cause if there is antibodies. I am going to shade a bit later. Okay, acid base abnormality. So always a question of acid base abnormality is asked. I would tell you how to solve it like now. So ABG analysis is done. What is the diagnosis? So ABG, now you can see 7 point, the range is 7.35 to 45. PCO2 is 45 to 35 to 45. So 3545 is the mnemonic. Okay. So your pH range is 7.35 to 7.45. PCO2 range is 7.35 mmHg to 45. So we can see that the pH has reduced. So this is a case of acidosis. Now PCO2 or bicarbonate has increased. So it is in the opposite direction. So ROMS, respiratory opposite, metabolic same. So this is a case of respiratory acidosis with metabolic compensatory metabolic alkalosis because the bicarbonate has raised. So respiratory acidosis because acidosis is there and PCO2 and pH are in opposite direction, rising. One is decreasing, one is rising. So ROMS, respiratory opposite, metabolic same. And we can see that the bicarbonate has also risen to counteract the acidosis. So this is a case of respiratory acidosis with metabolic alkalosis. A patient complained of discharge from his penis, okay, for the last 5 days. A sample was taken and sent to the lab on gram staining, gram negative cocci. Okay, Thier Martin, I think, if I am not wrong, Thier Martin. This is a case of gonococci. A female patient with lepromatous leprosy on anti-leprosy drugs. Patient with type 2 reaction, which is the immediate, any kind of reaction, first step is corticosteroids. Thalidomide in pregnancy never given because it causes phocomelia. And first step is always steroids. Thalidomide in later. So 7 questions from Dermat. All of the following are risk factors for surgical site infection except. There was a scoring, right? Regarding this, I have forgot that. Obesity, hypercholesterolemia. I don't think hypercholesterolemia would be the answer. Recent OT could be there. I'm going for this. Arrange the following of disaster cycle in logical sequence. Okay. Disaster impact. Response would be there. Rehabilitation would be there and mitigations measures would be taken. Disaster response impact. First, the impact would be there. This is a disaster cycle is also a previously asked topic. Long stem. A 45-year-old male presents with to the endocrinology department with complaints of polyuria, polydipsia, so diabetes. Maybe he reports these symptoms ongoing for several months. Each patient medical history is significant of a pituitary tumor which was surgically removed 2 years ago. He denies of any recent head trauma. Physical examination reveals no abnormalities. The laboratory test low urine specific gravity, low osmolality. So SIADH, ADH, ADH is IADH no, it's ADH deficiency. Diabetes. Oh, which type of diabetes insipidus? Okay, they have given only. Serum vasopressin levels are undetectable. Which type of? This is not nephrogenic. This is central diabetes insipidus. Yes. So like this, I made a diagnosis. I was telling you all that I made a diagnosis and I am seeing all the symptoms and changing the diagnosis. This activity you have to do. This activity would only help you to engage and generate the interest in your question solving also. A patient who presented with prolonged fever, splenomegaly, RK39 positive. So again, Kalazar, hey, this is the same question repeat. Liposomal amphotericin. So two questions have problem. One is a repeat question, and one the ECG was not given. Which all of the following are used in the management of sickle cell anemia except hydroxyurea is given, L-glutamine is also given. I hope portiloxetor is given. Papitovimab, I don't know this. I'm giving it. Kit 1 used for syndromic management for all except urethral cervical discharge, lower abdominal pain. It is not used. Lower abdominal pain, yellow, low, lower abdominal pain, yellow, low, lower abdominal pain. Okay, like that. You remember. Which amongst the following is the most common agent for agranulocytosis? Alkylating agents, I would go for agranulocytosis. Steroid doesn't cause agranulocytosis. Eosinopenia it can cause. Paracetamol endotoxin, why would it cause? Surgeon's knot, I have forgot knots, man. One was reef knot. Surgeon's knot. I think this one is surgeon's knot, if I am not wrong. WHO Formation Day, World Health Day, 7th April. Is the World Health Day and the 7th the same? I don't know. I am thinking that direction only. World Health Day should be the means WHO Formation Day because it is the World Health Organization. So should be the same. So 7th April. You all are having, and how many have joined? You know, I'm seeing ones. Okay, so ADP inside ATP, outside ATP is inhibited by, means the ATP transmission they are talking about. The transport of ADP inside and ATP outside mitochondrial membrane is inhibited by retinone 1 is there, so it inhibits the complex 1. Also barbiturate, I think cyanide. Oxygen formation it inhibits. I have to share it once later. Melt score, scoring I don't remember, but INR would be there, I think. Creatinine would be there, bilirubin would be there, I think. Albumin is not there, not sure though. A patient has both lower extremities crushed by a car. On admission, he is restless and complaining of pain in both legs. Myoglobinuria किसी तरह से हो सकता है. His BP is this and this, normal. Abdominal chest X-ray is normal. Both thighs are swollen and both the femurs are obviously fractured. Massive hemoglobinuria. What is the next step? I would go for maybe blood transfusion. Normal saline with bicarbonate. Acidosis. Furosemide. I would go for NS also. Furosemide for more. It's a bit of confused. USG, I think I won't do. Bicarbonate 5 would I give. Acidosis. Going for furosemide. Marking. 26 TB started on ATD. After ATD, presented in medicine department. Next swelling on investigation report shows increased TSH. Which of the following? Psychoserine to causes psychosis. Ethionamide, I think. I have to see that once later. Now difficult questions are coming. What behavior of suture returns to its original length Once tension is released, elasticity, I would say, elastic nature. Which of the following statement best explains purpose of planning? To match the limited resources with many problems? Yes. To eliminate wasteful expenditure? Yes, that is also true. To develop the best course of accomplishment with a definite. All are true, I think. I'm giving all of the above, though it has asked best. Hypercalcemia, small squamous cell cancer. All are small cell cancer except hypercalcemia. So this is diagnosis. Old man smoker presents with right arm. So proptosis, Horner syndrome is developing. This is an uh, apex tumor. Even below. Pancreas tumor. Yes, it is said pancreas tumor. I was forgetting a bit. So this is a case of pancreas tumor. Refeeding syndrome. So refeeding syndrome increases the insulin, right? Refeeding causes hypocalcemia, hypomagnesemia. Hypomagnesemia is given twice. Hypocalcemia will it cause uh, hypocalcemia? Hypocalcemia it shouldn't cause. I think hypocalcemia won't be the cause. Hypocalcemia occurs in blood transfusion, massive blood transfusion due to the citrate present. Laminar air exchange time. I don't know. Okay, follows. Number. This is a number 11 blood. I think 11. Suture cutting is number 12. Incision blood. Most common type of MODI is MODI 3. I hope. I'm hoping it's MODI 3. Remifentanil is an ideal drug for the total intravenous anesthesia of which of the following was ideal totally diva. I think metabolized by non-specific esteroids would be the answer. This is a long stem question. A 57-year-old male with a history of diabetes mellitus and hypertension presents to hospital with orthopnea. His blood pressure is at no, and his heart rate is this. Yes, heart rate is. He has clear lungs displaced. Now nothing is going inside my head. Totally tired and fatigued. His blood pressure is chest radiograph shows pulmonary congestion. Hemoglobin is okay, sodium is okay, creatinine is a bit high. Chest radiograph shows pulmonary congestion, cardiomegaly, dilated cardiomyopathy. ECG shows sinus rhythm, non-specific ST changes, premature ventricular complexes. Echocardiography shows left ventricular ejection fraction is reduced. Like best would be endomyocardial biopsy. You can see ninja star appearances, ninja stars like the ninja stars. A postnatal mother delivers 20 days back with increased tearfulness and sleeplessness. Anhedonia suicidal tendency. Then she is having depression. She claims baby is not real Not real one, as someone has already taken her baby from her womb. What's some when the psychosis is only developing, right? So psychosis, just tearfulness and sleeplessness. It was looking like postpartum blues. After that, we saw suicidal tendencies. We were feeling that yes, it is depression, but the last line that she's having psycho. So psychiatric questions are very less in this, I feel. A 66-year-old female presents with confusion. Blood pressure is found to be, yeah, the blood pressure is high. Physical examination notable skin thickening. Skin is thickened, facial telangiectasia. So this is a case of scleroderma. Initial treatment, what I can give? Eculizumab, eculizumab. Renal impairment is there. Captopril maybe I can give. Captopril I'm going for. This is a case of intussusception, like the target appearance we can see. Severe vomiting pediatric patient USG, intussusception. Target sign. Broadcast urinary sediments. Which of the following? Yeah, in the meantime, you can ask few questions also because only 20 minutes are left for this session to end. Broadcast in urinary sediment. What is nephrotic syndrome? CKD I would go for broadcast because in CKD we can see 56-year-old patient acute abdominal infection. He has history of liver failure. His physician has prescribed cephalosporin to tackle infection. Which of the following cephalosporin should be avoided in this patient of hepatic failure? Hepatic failure, there could be PT-INR abnormalities, so cefoperazone I would like to avoid because the liver synthesizes 2, 7, 9, 10 coagulation factors, and the PT-INR is being deranged by the cefoperazone also, and previously only due to liver disease there is derangement, so I am going for that option of the cefoperazone. Which of the following renal stones form only when the upper urinary tract is infected? So it is true white triphosphate stones. A 45-year-old male patient comes to your follow-up with apprehension of passing down color urine. He was prescribed a regime of antimicrobial for urinary retention 3 days back. He also complains of fevers, chills, and chest pain that started after he had started medications. Okay, the apprehension, urinary tract infection 3 days back, fever, chills, chest pain after started medication. What is the nitrofurantoin? Maybe the option. I don't have any idea about nitrofurantoin, but I am going to give it. And previous other options are fluoxacin, both are fluoxacin, so won't be. So among A and B, when two options confusion, always go for one. And I am going for nitrofurantoin. A 40-year-old patient was admitted with status epilepticus. During hospital, patient developed fever, myalgia, reddish brown urine also. Okay. Dipstick positive for hemoglobin. Status epilepticus and hemoglobin. Urine shows no sediments. What is the likely diagnosis? Dipstick positive for hemoglobin. Rhabdomyolysis. Extravascular hemolysis won't be the option. Intravascular, a bit of confusion in this one also. In case of blood loss, ideal fluid replacement. Blood products Now let's see 3 number lifespan. I have to guess this, man. I have to guess this. Let's see, lifespan 2 or 3 days or more than that. More than that. How many are in the option? Don't know actually how much would the answer. This is a question that might not be asked. Going for 5 to 7 days. Charlie could be caused. Platelet doesn't have. Uh, Mainly occurred case of RBCs. All of the above. Suspicious still. Oxygen inhibition would be there, I think, because oxygen only allows ADP to ATP. So cyanide would be the answer, according to me. Furosemide, I am clearing the mm, hypothyroid, ethionamide. I think ethionamide could be uh, ethionamide or pyrazinamide. Ethionamide maybe for thyroidism. Ethionamide only, I think I would go for. Pyrazinamide, mainly the peripheral neuropathy. So ethionamide I am going for. This I don't know actually. Hemoglobin is positive, but why status epilepticus, fever, myalgia? Myalgia means reddish brown urine, but urine dipstick is positive for hemoglobin. So hemoglobin would be the cause, no? Hemoglobin, if it is causing extravascular, won't release hemoglobin. So intravascular hemolysis. This one still stuck. Let's see if any. Okay, thank you. It is a great session. Thank you. If you have any other question, then you can ask me in the live chat only. Transfusion related nerve injury. Trolley. Um, Platelet, I don't think plasma. Going for all of the above. You can ask questions. This question I won't be attempting. Let's see if we could finish the session or not. I'm texting them. So, any other question? We have finished the session, and I am not going to check and review the in the last also. So, any other questions? What would be strategy just days before? Uh, few days before means what kind of exam are you talking? If it is PG exam, last few days you have to revise the whole stuff. Actually, you consolidate your stuff so that you can revise in last 7 to 10 days. For me, last 21 days was vital and a game changer. I increased my number about means I increased 40-50 marks more. Okay, we can submit the test. No, I think we can't submit the test right now. Patience. Yes, we doctors should have patience, and you all are giving test for so long. So I have also tried to give again the test. Yeah, I would show them what marks I'm getting. No term in that or no. Nothing guilt in that. I would show you the marks maybe in a post, or maybe in a post I would give in a community post that how much marks I've got in my YouTube channel only. Still now, how many have joined till now? Any questions? Now 17 people, so it is more. So if any other questions you have, any other, just hi in what I can answer. Hello. So any other question if you have, you can ask in this time before the session ends.
Hi, Dr. Mayukh. I'm
Yeah,
Ravi.
hello, Sai.
I'm Ravi from DocTutorials. Thank you for taking so much pain for the last 3.5 hours. I think one comment that has come is about the patience. I think, let alone solving a GT for 3.5 hours, that itself is a lot of time to sit in one place and think thoroughly. But talking your mind, or talking whatever is going on in your mind throughout the 3.5 hour session, I think you have done a wonderful job of it, Dr. Mayukh. Thank you so much for this. There are a couple of questions that I would want to ask before we end this stream. Uh,
Yes, sir.
One question that comes very frequently is about taking GTs itself. Number one is, how many GTs should I take? From a lot of students, this question comes from: how many GTs should I take during my preparation, and when, at what point in my preparation should I start taking GTs? Even before I start, should I at least take one GT to understand how the questions are framed and how to prepare for those?
I think, sir, starting, what I would suggest is completing 13 subjects. That is at least completing your part one and the major four of the final year subjects, or at least 13 subjects. You should start giving the GTs. Earlier it is better. It is means from final year, if you are in the preparation phase from final year, then it is well and good. But if you are during internship, you should start giving GTs. Like, I had covered all the subject, but I hadn't revised. But as soon as my internship started, I started giving GTs. The number, actually, at least we should give 10 to 12 GTs, but the more it is, the better it is. So 1 year of GT solving, the frequency that all apps are giving, whichever app you have, I would say that give in the frequency that the app is giving. And nowadays I am seeing that DocTutorials GT is also very much good. Only one question was repeated. Rest all were NEET PG standard only. So all the platforms are giving good GTs. So the platform you have subscription, you give the GTs of that app. But there is what's called the bias of the application. That is, the questions are framed maybe by the similar people or faculties. So they you are tending to get them more correct. So once or twice you should change the platform, and you should shift and give a free mock test for from another platform. You can get some free mock test. Then you can see that how much I am able to get in this one also, because you won't have the same images and all. So that would be a good test. Like, I had also means I had a subscription, but I still gave GTs from other apps also. I also gave one GT, one or two GTs from DocTutorials also. So I used to do that to prevent the bias from one platform.
Right, sir. So one more thing is, this is at a personal level itself. Like, आपको कैसा लगा after so much of time? I think you are taking a GT at a stretch for GT at a stretch after probably a year's time?
Yes, sir. 1.5 years maybe. Means
What?
once I had done a YouTube video on that, I tried to solve a GT. After that, this is the first time. Means I have been detached. Though I keep for my YouTube guidance, I keep a bit of touch. So I think the standard was like that of NEET PG only. During the GT also, I said that the standard is more or less like NEET PG because I am able to solve many questions of that. So after not being in that much rigorous culture, if I am able to solve, and NEET PG standard is like that only. So we are seeing the rising cutoff and all. This is more or less like NEET PG only and predictive of the exam, I would say.
Great, sir. Sir, I'll end it with one last question. When we talk to a lot of interns, many a time we get to hear from them that they have not prepared, they have not started seriously preparing for the NEET PG right now, and they will probably go for 1 year long term coaching somewhere, or probably they will take one app for one extra year and then prepare through it right after their internship is over. Given that the NEET PG is uncertain, I mean, kabhi bhi ho sakta hai, it is getting postponed and all. Do you think while giving a good, giving our best attempt during internship, it helps us in answering a lot of clinical questions? Do you think कि वो होता है, and later on अगर आप एक साल drop ले रहे हो तो शायद आप you will be out of touch with clinical questions based on internship? Do you think that plays a role?
Mm, this thing I would like to say in different way because means the thing you said, sir, that the things we do in means learning has three domains. One is the cognitive domain, one is the psychomotor domain, one is the emotional domain. So the internship work we are doing, we are practicing, so it is a psychomotor domain. So it is the thing is not that we are going to forget it because we are practicing it in practical. Like question was in this year INI-CET November also, that how you sterilize an inoculation loop. We all remember that we heat it in the red flame and we heat it till red hot. No other sterilization is used. So I have done it 6 years before, and now also I remember it because it is in the psychomotor domain. But the thing is that this idea that I won't be in touch, I would be yes, you should focus on internship, but in internship, even if it is very much hectic, like in our state it was hectic, still we get some blocks of subjects like in community medicine or the short subjects when we have a lot of free time. So I also see some interns are there that they are going roaming out partying, they are going for a trip. Yes, you can go for one or some such, but totally detaching from the studies, one thing your habit would go wrong, that you would lose the habit of studying for a long hour. After that, when you think of that, yes, my internship is over, now I'm going to sit it straight, then you would feel a lot of problem. And the second thing is that the culture would go away from you. Okay, that the culture, you would leave the culture of preparation. So that is also another disaster. Even if you are not feeling that you are needing a year drop, but still be in a culture that you are studying. At least when you are giving rounds, you are asking the faculties, not just doing the clerical work, you are revising the stuff. At least be in a touch. And this year, as you have said, sir, that there is postponement, then they would repent very much that, oh shit, I am not given a try, now it has postponed to 4 and 6 months. After my internship, I can't give a good attempt. If I had studied something, I would have cracked it this year. So a year is vital. If you are feeling that your preparation is not ready, then also have a culture, do the internship seriously, then you would have a solid base so that you can build a empire on that, a Burj Khalifa on that. So that much base is necessary. I think that culture is necessary. So
I think great words, great insights. These are basically, I think no one think, a lot of students don't think beyond the bubble that they are in. I mean, वो college में वो internship चल रहा है, अभी मेरे को ये करना है, मैंने बाद में सोचना है, kind of thing. But I think it's always good to at least try attempting it during your internship. At least you will get the actual exam. ये वाला actual exam experience, even if you are probably not prepared to the fullest of your extent, and next year you can take learnings from that. I think great insights from you, sir. Thank you so
Yes,
much
sir.
for this.
Means the thing starts in the first year itself in the medical college itself, that
Hmm.
you try to copy your seniors, but never do something, means never don't follow the advice of the seniors with like whom you don't want to become. Like in the first year they tell that, no need to read everything, I would mark your book, you just go and read it, and that would only come in the exam. Like in when I was in my hostel also, this trend was there, that marking books from seniors, students used to go and that topic only they used to read. But I felt that even that I felt that I want to understand the whole topic. I am not going to prepare for a single exam and vomit it, and I am going to learn the topics by heart. So I used to study the whole book. Later, I used to see the previous 10-year questions of that maybe university exam. Then I used to solve those 10 years. But I used to study the whole topic. Even for my gold medal exams, also, I never took advice of any senior, maybe the previous gold medal holder, because I thought that I would try my own way. It would take time, but I would have a personalized way, and that would be the key to success. And that is only I'm trying to share also. I think so this mentality is that that needs to be broken, that don't imitate your seniors with like whom you don't want to become. Like if you want to follow, then and if you want to succeed in the PG entrance exam, then follow the seniors, those who have cracked. Maybe you won't get many from your college actually, then you can, now the social media is there, every coaching apps are highlighting their own talents, the toppers. So try to imitate their advice. I think this is the main problem, that they're becoming the sheep herd. They are going into the sheep herd, and how others are going, they are just imitating that.
Yeah, man did not evolve from apes to behave like sheep. So
Yes.
I think great advice, sir. I think there are some questions coming in the comments here. Sujit Kumar,
Okay,
Dr.
sir.
Sujit Kumar is saying, Dada, tumi khub bhalo, sir.
These are spamming, I think, sir.
Yeah, I
GTs
think
most of the time. Reviewing GT, yes, it takes a time, but reviewing a GT, if you review it then and there, then it won't take that much of time. And sometimes I used to do review GT just before my NEET PG exam with one of my friend. Uh, that took a bit of more time, but we used to exchange our knowledge. Like he told that IgG2 is not passed, means IgG is passed from mother to fetus. दो नंबर पास नहीं होता, क्योंकि दो नंबर मतलब दो नंबर ही चीज है, तो उसको पास नहीं करने देता. So like this, I also used to share some tips and tricks. He used to also share some insights. This helped in, means if you are having a study partner, then it is well and good. Means you can both give your inputs and you could shine. And the as soon as possible you review the GT, the lesser time it would take. The more delay you would do, you would forget the questions. What was the question, what was the answer I marked, that would be a problem. And mainly try to review the, okay, the marks has also come, I think. So 152 corrects is, I think, good for me now. So you should review the GT as soon as possible. And if you can't review all the questions, then see which all mistakes you have got, and the guess questions you can see at first, and the correct questions you can go swap through them quickly.
sir. I think coming to the review part itself, I think we at DocTutorials, what we have added as a feature is from all the GTs that we will be conducting from the month of January, there is going to be a video explanation of each of the questions by the faculties who are teaching. So अभी एक क्वेश्चन होगा तो उसको how would a faculty attempt it and what how is he analyzing it. I think that art of solving MCQs is very important, and that is what we are trying to showcase through that. Do you think that kind of a feature would be
Yes, sir.
helpful for students to review it quicker?
Yes, sir. Yes, sir. Mainly solving MCQs means watching to see solve MCQs is also very much necessary, because if you are means if you are wanting to become a great batsman, then you should see that how Virat Kohli is playing, how Rohit Sharma is playing, and you try to imitate them. So you should see how the top faculties or how the toppers are actually solving MCQs. Like this session was also like that only. So this helps you to see that what direction actually they're thinking. Like both logo, they don't think the idea that how to rule out options. People are saying that you rule out options from your guesswork and all, but how to actually rule out, how to actually approach this thing may be lacking. So this is always a good thing that you see that how the toppers and the top faculties are actually showing. Then you would understand the trick. Then you try to apply it. First you see it, then you apply it. Then only you would get a better result.
Thank you. Thank you so much, sir, for this amazing session. I think a lot of people who are going to watch it even in the future are going to take a lot of insights from the way you were approaching the questions, from the way you were eliminating the options. And in fact, the last 10 minutes of the talk that you had with me, I think it is very enriching, a new different perspective that we don't normally get probably from the faculties, but you are someone who has done it very recently, and that kind of a perspective is a very, very fresh perspective for the students to also probably implement in their preparation. Thank you so much for this humongous effort, I would say, more than commendable. Great show, sir. Thank you so much for joining
Thank
us.
you so much for hosting me also and giving me the opportunity. I really like this platform, and I like this challenge also. So I am also getting now 565 marks. So it is a great marks, I think, after not having rigorous culture. Means my
Absolutely.
first during my first GTs, I used to get about 140s, 150s correct. So I am still going in 152 correct. So it is a good score only, I think.
Great, sir. Thank you. Thank you so much, sir.
Thank you so much.
Yeah.